Good morning. The Committee of Health, Hospitals, and Human Services is hereby called to order. Madam Clerk, please read today's agenda into the record.
The Committee on Health, Hospitals, and Human Services has scheduled a hearing for Tuesday, August 17th, 2021 at 10 a.m. in the Fritz E. Lowetz Legislative Conference Room to receive testimony on the following bills. Bill number 34-0051, an act amending Title 19 Virgin Islands Code, Chapter 75, Section 4201, relating to fluoridation of water to lower the required minimum amount of fluoride in fresh water distributed for public consumption or for consumption in any schools in the Virgin Islands. Sponsored by Senators Marvin A. Blyden and Novell E. Francis, Jr. Invited testifiers: the Honorable Justa E. Encarnacion, Commissioner, Virgin Islands Department of Health. The Honorable Raquel Berry Benjamin, Commissioner, Virgin Islands Department of Education. The Honorable Kimberly Kazi Gomez, Commissioner, Virgin Islands Department of Human Services. Mr. Noel Hodge, Interim Executive Director, Virgin Islands Water and Power Authority. Mr. Molito Smith, Chief Executive Officer, St. Thomas East End Medical Center Corporation. Dr. Jane Grover, Director, Advocacy for Access and Prevention, American Dental Association. Ms. Tuka Zokai, Manager, Fluoridation and Preventive Health Activities, American Dental Association. Dr. Sonia Taylor Griffith, Executive Director, Virgin Islands Dental Association. Tom Bolt, Esquire, Legal Counsel, Virgin Islands Dental Association. Ms. Masiri Sproul Webster, Chief Executive Officer, Frederiksted Healthcare, Inc. Bill number 34-0040, an act amending Title 27, Chapter 1 of the Virgin Islands Code by adding a new subchapter 5A, establishing the Nurse Licensure Compact to create a multi-state nursing license, sponsored by Senator Kurt A. Violet. Invited testifiers: Rebecca Fash, J.D., Director, State Advocacy and Legislative Affairs, National Council of State Boards of Nursing. Tanisha Penn, R.N., Chairperson, Virgin Islands Board of Nurse Licensure. The Honorable Justa E. Encarnacion, Commissioner, Virgin Islands Department of Health. Carmen Vanterpool Romney, Territorial Executive Director, Virgin Islands Board of Nurse Licensure. Louis O. Amaro, MD, Interim Chief Executive Officer, Snyder Regional Medical Center. Ms. Daima Williams, RN, BSN, MJ, CPHRM, Interim Chief Executive Officer, Governor Wang F. Louis Hospital and Medical Center.
Thank you very much, Madam Clerk. And again, a pleasant and blessed good morning to the people of the Virgin Islands. Today, the Committee of Health, Hospital, and Human Services is convened to consider two bills that will support health care and dental care across the territory. We have quality health care and dental care in the Virgin Islands, and I believe it's important to provide legislative support where it's needed to support our health and dental care systems, providers, and community health. Our health care and dental care systems are not without their challenges, but I think we can all agree that both our health care providers and our dentists work hard to ensure a high standard of care to our public. The bills offered today will remove barriers to the nurse licensure process, lowers the required minimum amount of fluoride in fresh water for public consumption or consumption in any schools in the Virgin Islands, as well as recognizes the importance of dental preventive services from a young age. Before we proceed today, I would like to take a moment to implore our community, our citizens, our constituents of the importance of taking the vaccine. Please, please, please consider taking the vaccine. The Virgin Islands COVID-19 cases have now topped over 300 and rising. We understand that the vaccine is not a cure-all, but it does give you a fighting chance. The combination of taking the vaccine, wearing your mask, washing your hands, and social distancing minimizes the chances of you catching the COVID-19 and the Delta variant. Please remember, the life you save may be your own. I will ask that you join me in a moment of silence as we continue to pray for our brothers and sisters in Haiti as they have received that unfortunate ravage of that earthquake. Over 1,300 individuals have died and many more injured, as well as what's going on over in Afghanistan. Also, while we're doing that moment of silence, let's consider all those individuals that have lost their lives here in the territory due to COVID-19. Moment of silence. Thank you very much. At this time, I'd like to remind all present and participating via video to please turn your cell phone off or turn them on silent as to not interrupt today's proceedings. And I ask the Madam Clerk to please call the roll.
Senator Marvin A. Blyden. Senator Blyden, present. Senator Samuel Carrion. Senator Carrion, present. Senator Kenneth L. Gittins. Senator Gittins, absent. Senator Alma Francis Heiliger.
Present.
Senator Francis Heiliger, present. Senator Janelle K. Soro. Senator Soro, absent. Senator Kurt A. Violet. Senator Violet, absent. Senator Novell E. Francis Jr. Senator Francis Jr., present. Mr. Chair, 4 members present, 3 absent.
Very well, thank you. We do have a quorum and prepared to proceed. We do know that we have correspondence to be read into the record. You may go ahead and read those correspondences into the record.
August 17th, 2021, the Honorable Novell E. Francis Jr., Chairperson, Committee on Health, Hospitals, and Human Services, 34th Legislature of the Virgin Islands, 3022 Estate Golden Rock, Christiansted, VI, 00820. Dear Senator Francis Jr., I will be tardy for today's Committee on Health, Hospitals, and Human Services hearing. I apologize for any inconvenience this may cause, and I look forward to participating upon my arrival. Thank you for your kind consideration in this matter. Respectfully, Kurt A. Violet, Senator, 34th Legislature of the Virgin Islands.
Any other correspondence, Madam Clerk?
No, Mr. Chairman.
Thank you very much. At this time, we could mark Senator Violet as excused and also notate that Senator Saru is on her way over to the chambers at this time. She's on her flight, making her way over. Let's do a device check at this point. And of course, we'll be considering the first bill on today's agenda, Bill 34-0051, an act amending Title 19 Virgin Islands Code, Chapter 75, Section 44201, relating to the fluoridization of water to lower the required minimum amount of fluoride in fresh water distributed for public consumption or for consumption in any schools in the Virgin Islands. At this time, Commissioner Encarnacion.
Good morning, everyone. Commissioner Encarnacion.
Morning, Commissioner. You're loud and clear. Commissioner Raquel Berry Benjamin.
Good morning, Senator. Good morning, all.
Morning. Commissioner Kazi Gomez, I know she sent in a correspondence, testimony that will be read into the record. Interim Executive Director or his representative, Mr. Noel Hodge.
Good morning, Senator.
Morning. Chief Executive Officer of the St. Thomas Eastern Medical Center Corporation, Mr. Molito Smith, or a representative.
Dr. Lucien Molinar, present for Mr. Molito Smith. Good morning.
Morning, Dr. Molinar. Dr. James Grover from the American Dental Association.
Good morning.
Morning. Ms. Tokia Zokai, American Dental Association.
Present, thank you.
I'm sorry?
I'm present, thank you.
Very well. Dr. Solia Taylor Griffith, Executive Director of the Virgin Islands Dental Association.
Good morning, Senator. Present.
Morning. Attorney Tom Bolt, Legal Counsel.
Good morning, President.
Morning. Chief Executive Officer of the Project Said Healthcare, Ms. Spro Webster. You muted, Ms. Webster.
Good morning. Sorry about that. Good morning to everyone. With me is Dr. Dale Manuel, our Chief Dental Officer.
Very well.
Good morning, Senator.
Good morning. Good morning to Ms. Webster and also Dr. Manuel. Any other representative at this time? Education, I thought you have several individuals that will be assisting you today.
Good morning, Joseph Sibley, Territorial Facilities Manager.
Morning.
Good morning, attorneys. Go ahead, Mr. Benner. Sorry.
I'm sorry. Good morning, James Burnett, engineer for the Department of Education Operations.
Hi, good morning. Cynthia B. Moore, legal counsel with the Department of Education.
Very well. And Interim Executive Director of the Juan Francisco Louis Hospital, Ms. Daima Williams.
Good afternoon. Sorry, good morning, everyone. I am present.
Okay, you have someone else that will be with you, Ms. Williams?
I do have Ms. Siobhan Thomas, that's our Chief Legal Counsel, but we're testifying on the second session, not this one.
Okay, very well. Thank you. All right.
Thank you, sir.
Very well. At this time, we'll go to the bill sponsor, Senator Blyden. Who speaks to this bill? Senator Blyden, you're recognized for presentation of Bill 34-0051.
Thank you, Mr. Chair. Good morning to my colleagues and the people of the Virgin Islands. Bill number 34-0051, an act amending Title 19 Virgin Islands Code, Chapter 75, Section 4201, relating to fluoridation of water to lower the required minimum amount of fluorine in freshwater distribution for public consumption or for consumption in any school in the Virgin Islands. This measure, authored by myself and also sponsored by Senator Novell Francis, came about the way that most of my work is done. It arose from constituent service and from working with residents. In this case, I was working with seniors at the Celestinian White Center about some water quality issues, and it led my staff and I to research everything in the VI code regarding drinking water. In the process, we came across language in the code regarding a requirement for WAPA and other entities to fluoridate drinking water provided to the public. And we saw that the standards needed to be updated to reflect current guidelines of the U.S. Department of Health and Human Services. Along the way, we also recognized that for a variety of reasons, just addressing community water fluoridation wouldn't be enough, and that it would be necessary to carry a dental prevention program into our schools. And this is what this bill is seeking to do. This bill lowers the mandated amount of fluorine that should be added to drinking water from the current 0.8 to 1.2 milligrams per liter to 0.7 milligrams per liter. in line with the latest guidelines from the U.S. Department of Health and Human Services. The reason for lowering the guideline is that the lower amount has been found to provide sufficient protection without running a risk of dental molting that can occur with higher concentrations of fluorine. The bill strengthens existing language governing the school health program by clarifying that dental screening is a mandated part of the annual health assessment, which must be undergone by students entering public or private schools. Additionally, it creates a school-based preventative dental program. It puts a funding mechanism in place, and it makes provisions to allow out-of-state licensed dentists, residents, and dental students to volunteer the services in a school health-based prevention program without running afoul of the Dental Practice Act, which would otherwise require such volunteers to be licensed to practice dentistry in the territory. But why is this issue of fluorine and a school-based dental health assessment and preventative services so important in the first place? Here are just a few facts to show the importance of this issue. Tooth decay is the most common chronic childhood disease, even more common than asthma, and it impacts a child's ability to carry out normal, everyday activities. This prevalence carries into adulthood and is disproportionately prominent in minority communities. As the CDC notes, that cavities are one of the most chronic conditions in the United States. Non-Hispanic blacks, Hispanics, and American Indians and Alaska Natives generally have the poorest oral health compared to other U.S. racial ethnic groups. Nationally, more than 1 in 4 adults have untreated cavities, and nearly half of adults aged 30 or over show signs of gum disease. More than 1 in 6 adults aged 65 or older have lost their teeth, which can have a profoundly negative effect on nutrition and well-being. A growing body of research has identified a connection between oral health and chronic diseases such as Alzheimer's, diabetes, and other serious conditions affecting millions of people. According to the Centers for Disease Control, over $45 billion is lost in productivity each year in the United States because of untreated oral disease. Research shows that school-based fluoridation programs reduces the incidence of childhood decay by 30%. These studies include 2 research projects conducted in the Virgin Islands school system from 1954 to 1962 and during the 1980s. A school-based fluorine program is defined as the coordinated use of fluorine in a school when students from age 6 to 18. School-based fluorine mouth rinse, supplement, and toothpaste programs were designed during the 70s and 80s to be delivered to all children in schools as alternative to community water fluoridation. Previous legislation had attempted to address the shortage of dental providers through the licensing of dental hygienists. This legislation tackles the issue from the other side, which is that of prevention, since, as the old folks say, an ounce of prevention is worth a pound of cure. It is clear then that this measure seeks to address a critically important component of overall community health by amending standards for community water fluoridation and by creating a school-based assessment and prevention program for our children. I am pleased to have had the opportunity to work closely with people of goodwill in both the public and private sector. And I am particularly thankful to the VI Dental Association and American Dental Association, as they have not only done tremendous work in helping on this legislation, but they have committed to providing a substantial amount of resources and personnel to set up and maintain a school-based prevention program. We look forward to a day when widespread dental disease in the Virgin Islands will be a thing of the past. And I ask for my colleagues to support this most important piece of legislation that will change the lives of future generations. I thank you so much, Mr. Chair, for the introduction of this most important piece of legislation. Thank you.
Thank you very much, Senator Blyden, for that extensive but excellent presentation on Bill 34, that's 0051. At this time, we'll go to the testifiers for their testimony, and of course, we'll go in the order that was called by the Madam Clerk. Commissioner Encarnacion, you're recognized for your testimony at this time.
Thank you very much, Senator. Good morning, Honorable Senator Novalee Francis, Chair on Health, Hospital, and Human Services, members of the committee, and other members of the 34th Legislature of the Virgin Islands of the United States, and of course, the listening and viewing audience. I am Justa E. Encarnacion, Commissioner of the Virgin Islands Department of Health. I have here with me today Dr. Nicole Crackle-Sims, Assistant Commissioner. Thank you for the opportunity to testify on Bill number 34-0051, an act amending Title 19, Virgin Islands Code, Chapter 75, Section 4201, relating to fluoridation of water to lower the required minimum amount of fluoride in fresh water distributed by for public consumption or for consumption in any schools in the Virgin Islands. I want to thank you, Senator Francis and Senator Blyden, for sponsoring this bill. According to the Virgin Islands Department of Health and Human Services, the optimal fluoride level in drinking water to prevent tooth decay should be 0.7 milligrams of fluoride per liter of water. The American Dental Association supports this recommendation as an effective measure to provide protection against tooth decay. The recommendation to change the optimal level from 8 milligram per liter to 7 milligram per liter recognizes that people now have access to more sources of fluoride, including toothpaste and mouth rinses, than they did when municipal water sources first began adding the mineral to water supplies across the United States. Once fully implemented, we believe the proposed recommended level will maintain the protective benefits of water fluoridation for the population. There is ample evidence that water fluoridation continues to be an effective and the most effective strategy for the prevention of cavities. Furthermore, access to fluoridated water is a key objective, including in Healthy Virgin Islands 2030, the Community Health Improvement Plan currently in the final stages of development and will serve as the overarching framework for improving the health of the Virgin Islands USVI population for the next 10 years. In addition, the 2020 Title V Needs Assessment reflected that oral health is a top priority in the territory's children's population. In response, the department's Maternal and Child Health Program, or MCH, is currently working on implementing oral health in MCH clinics. To begin to address the good oral health in the territory's children, the MCH division engaged in a brush and floss campaign in February, which is a National Children's Oral Health Month. In order to increase access to fluoride treatment, MCH collaborated with the American Dental Association and conducted a brush and floss outreach territory-wide. The outreach distributed dental health kits that contained a toothbrush, toothpaste, Listerine, floss, and brush and floss t-shirt that engaged children to brush and floss twice a day. Over 500 children benefited from the brush and floss outreach that was done territory-wide. At the beginning of the fiscal year 2022, MCH will begin implementing oral health by utilizing Title V funds. The Department of Planning and Natural Resources currently holds the responsibility for the drinking water program under the public municipal system governed by Chapter 19 of the VI Code, Section 1301 to 1311. After discussion with Commissioner Jean-Pierre Oriol, the department respectfully recommends the following changes to Bill number 34-0051, an act amending Title 19, Virgin Islands Code, Chapter 75, Sections 4201, 4203, responsibility for administration and enforcement. The Department of Planning and Natural Resources shall be responsible for the administration and enforcement of this chapter, shall conduct periodic inspection of water production and or distribution facilities of compliance with the provisions hereof, and shall promulgate rules and regulations related to the fluoridation of public and school water supplies, which shall include but not limited to the following: the means by which fluoride is controlled, approved methods of testing for fluoride content, and records and data be kept relating to fluoridation. In contrast, the Department of Health shall be responsible for the surveillance and enforcement of safe drinking water coming from establishments that supply water to the public that comes from non-municipal sources as cisterns and man-made wells. The criteria would be as well the means by which fluoride is controlled, approved methods of testing for fluoride content, and records and data to be kept relating to fluoridation. As always, I would like to thank the Virgin Department of Health family. In conclusion, Senator Francis, the Department of Health continues to fulfill the tenet of our vision to reducing health risks, increasing access to quality health care, and enforcing health standards. And as always, the department commits to continued collaborative efforts with the members of the 34th Legislature. Senators, this concludes our testimony. Thank you for your support of our efforts as we continue to build a healthier Virgin Islands. I welcome the opportunity to respond to questions you may have. Thank you, Senator.
Thank you very much, Commissioner Encarnacion. Madam Clerk, please recognize the presence of Senator VLA. And at this time, we'll go to Commissioner Barry Benjamin for her testimony. Commissioner Benjamin.
Good morning, Honorable Senator Novell E. Francis, Chairman of the Committee on Health, Hospital, and Human Services, members of the committee, other members of the 34th Legislature, other testifiers, and the listening and viewing audiences. I am Raquel Berry Benjamin, Commissioner of the Virgin Islands Department of Education. I am pleased to present to you the VIDE's position on Bill number 34-0051, which proposes to amend Title 19 of the Virgin Islands Code, Chapter 75, Section 4201, relative to fluoridation of water available for public consumption or for any consumption in schools of the U.S. Virgin Islands. More specifically, Bill number 34-0051 aims to lower the required minimum amount of fluoride in fresh water from not less than 0.8 of 1 milligram per liter to not less than 0.7 of 1 milligram per liter. Here with me to provide support for the VIDE's position on this bill are Attorney Cynthia Moore, Mr. James Bernier, our engineer, and Mr. Joseph Sibley, our Territorial Facilities Manager. The VIDE understands the importance of and agrees with ensuring the water supply systems should supply communities with optimal fluoridation as a safe and effective public health measure to prevent tooth decay. Statistics have proven that this measure improves the public's overall oral health, and community water fluoridation has been recommended nationally by agencies such as the American Dental Association, American Academy of Pediatrics, U.S. Public Health Service, and World Health Organization. Accordingly, the CDC Control and Prevention proclaimed that the community water fluoridation is one of the 10 great public health achievements of the 20th century. Many organizations and school districts have embraced this initiative and have implemented procedures to ensure community water fluoridation. However, the VIDE is structured differently. We receive water to our schools through the utilization of the public water supply, which comes from the Virgin Islands Water and Power Authority. Additionally, those few facilities that utilize cisterns still have the water truck from supply stands that receive water from the authority. However, the VIDE stands in support of community water fluoridation, thus understands its role in ensuring that our students' oral health care remain a priority. Presently, any testing and treatment of our water supply is of or related to the levels of bacteria in our water supply. Currently, the department outsources the testing of water at our sites utilizing independent contractors such as Ocean Systems. Nevertheless, it is our goal to build capacity within the department to conduct the necessary testing and services to include water fluoridation in schools that utilize cisterns as mandated by the law, and of course with the proper guidance from the appropriate authority at that time. On August 14, 2021, the Office of Senator Marvin Blyden held a meeting to begin the discussion around a school-based initiative that may help to remove systemic barriers and increase access to oral health care, thus help to improve oral health for our early childhood, pre-K through third grade students. Although the meeting was preliminary, it provided the opportunity for the Virgin Islands Department of Health, prominent members of the Virgin Islands Dentistry, and other stakeholders to begin the much-needed dialogue. Discussions include programs for weekly oral rinses, dental sealants, and the dissemination of toothbrushes for our early learners. The meeting concluded with stakeholders buy-in and the expectation of future collaborations. The VIDE looks forward to collaborating on this critical initiative. In closing, I would like to say that addressing the needs of the whole child is the priority of the VIDE. Thus, we support Bill number 34-0051, which represents a step toward raising awareness of and support for the oral health care of our most precious Virgin Islanders. Mr. Chairman and fellow committee members, we are deeply appreciative of the opportunity to share our position with you today. We are available to answer any questions you might have. Thank you for the opportunity.
Thank you very much, Commissioner Benjamin, for your testimony. Madam Clerk, can you also recognize the presence of Senator Franklin Johnson? He's been here all morning. So a gold star for Senator Johnson for certainly being here. Thank you very much. At this time, we'll go to, we'll leave the testimony for Kazi Gomez. I'll have you read that at the end. And at this time, we'll go to Interim Executive Director, Mr. Noel Hodge, for his testimony.
Good morning, Honorable Majority Leader Marvin A. Blyden, honorable members of the Committee on Health, Hospital, and Human Services, other senators present, testifiers, and the listening and viewing audience. My name is Noel Hodge, Interim Executive Director, Chief Executive Officer of the Virgin Islands Water and Power Authority, VWAPA, or the Authority. I thank you for allowing me the opportunity to provide testimony on Bill number 34-0051, an act amending Title 19, Virgin Islands Code, Chapter 75, Section 4201, relating to the fluoridation of water to lower the minimum amount of fluoride in fresh water distribution for public consumption or for consumption in any schools in the Virgin Islands. The Authority appreciates the efforts put forward by this body to ensure all drinking water standards and guidelines are adhered to by public and private entities. It's important that we maintain our policies aligned with industry standards for the continued benefit and safety of the Virgin Islands community. Under the current operating guidelines mandated by the Environmental Protection Agency, EPA, and the Department of Natural Resources, DPNR, the Authority is not mandated or required to inject fluoride in the public water system. As such, the Authority does not utilize fluorine in our day-to-day water distribution operations. Across the United States, at the state and local level, and with community input, several geographical areas on the mainland have opted to inject fluoride into their potable water system based on source water quality and statistical data, which reflects the need to improve the oral health of individuals within that specific population, predominantly adolescents. We estimate that approximately 65 to 75% of Virgin Islands consume bottled water. Most bottled water products labeled as deionized, purified, or distilled have been treated in such a way that they contain no or little trace amounts of fluoride, unless they specifically list fluoride as an added ingredient. Other bottled water products, such as spring water, can contain fluoride that is added or naturally present in the original source of water. Since fluoride can naturally occur in drinking water based upon the geological composition of soil and bedrock, and is present at various concentrations in all water sources within the territory to include rainwater, seawater, and groundwater. The authority has contracted 7 Seas corporations to fulfill the territory's potable water demands utilizing the latest in reverse osmosis technology. This technology filters out impurities resulting in undetectable levels of fluoride. In closing, the authority will continue its commitment to operate a safe and reliable water distribution system in compliance with the water standards mandated by the EPA and DPNR. And the authority thanks this body for the invitation to provide testimony on this matter.
Thank you very much for your testimony, Executive Director Hodge. And next we'll go to Dr. Molinar, who's representing Mr. Molito Smith of the St. Thomas East End Medical Center.
Good morning, Senator Novelli Francis Jr., Chairman of the Committee on Health, Hospitals, and Human Services. Other members of the committee, good morning to other senators present and other testifiers and all persons listening or participating live or electronically. I am Dr. Lucien Molinar. I bring greetings from Mr. Molito Smith, Chief Executive Officer, and the entire staff of the St. Thomas East End Medical Center, commonly referred to by its initials, STEEMCC or STEAM-CC. We're a federally qualified health center located in the Tutu Park Mall on the east end of the island, where I occupy the position of Director of the Dental and Oral Health Unit. We are pleased for this opportunity to testify on Bill 340051, amending Title 19 of the Virgin Islands Code. STEAM-CC is committed not only by federal mandate, but also by internal resolution to providing comprehensive health care, including by definition, preventive and community outreach care. This commitment is reflected in the program planning and service modules of the Oral Health Unit of STEAM-CC, where 2 dentists rotate in the pediatric dental care program and 2 dental hygienists perform preventive dental services such as topical fluoride application and sealants to the teeth and in patient oral health education. We also perform monthly dental screenings and referrals of the St. Thomas Head Start student population by our STEAM-CC dental staff. In performing clinical and outreach dental services, we get to see firsthand the extent of prevailing dental diseases, especially tooth decay in children, and we see the debilitating effect on adult life caused by missing or diseased teeth and infected oral soft tissues, the gums. Therapeutic measures or treatment alone cannot correct the ongoing prevalence of poor community oral health. Prevention is and always has been the key. So it is with welcoming enthusiasm that STEAM-CC received notice of this committee's intent to institute what has been the cornerstone of tooth decay prevention, fluoridation, into the school system of the Virgin Islands, and to adjust the level of fluoride required in the public water system to accepted national standards. And we stand ready to assist in any way programmatically possible. Our enthusiasm, however, is tempered by the realization that an effective school-based health program requires a commitment of personnel and funding for the long haul, not just for the courtship of a new idea or for a one-year scientific study. A fluoride mouth-rinse program in schools can yield tremendous positive results in the oral health and general well-being of our students and their families, but it requires sound interagency planning, cooperation, and a major sustainable funding. Decades ago, a major study of adhesive dental sealants to protect teeth was conducted in the Virgin Islands on the student population under the joint auspices of the National Institute of Dental Research, the University of Texas Dental School of San Antonio, and the local Department of Health. The materials used in that study were the precursors of today's more successful dental sealants for teeth. In addition to being a successful test project, the study taught us over its 3-year duration how difficult even a captive patient population can be to maintain proper protocol in light of equipment, supplies, waste product management, classroom schedules, and even student compliance. The study had a successful completion and was definitely instructive as to the burdensome requirements of carrying out a school-based oral health program. On the positive side, we are encouraged by the initial and ongoing interest and support exhibited by the American Dental Association through Dr. Jane Grover and her associates and staff, and the express commitment of the local Virgin Islands Dental Association, Dr. Sonia Griffith and her associates. On a programming note, STEAM-CC urges that baseline data on the existing dental health of the school population be a top priority in the initial stages of the program. It is essential that we know the extent of the problem before we plan to correct it. Baseline data also provides evidence on which to measure the program's success or failure. A DMFT, which stands for Decayed, Missing, or Filled Teeth, DMFT, a measurement of those teeth of a representative sampling of the population is essential prior to any broad-based dental health initiative. STEAM-CC is committed, and we look forward to continued participation in the effort as our staffing and program and planning permit, and we commend the committee for bringing this initiative to the floor. Finally, on the other matter of amending Section 4201 of Title 19, reducing the minimum level of public water fluoridation to 0.7 milligram per liter, STEAM-CC agrees with the intent of this amendment to comply with nationally accepted standards of water fluoridation. Notwithstanding, however, that the matter of public water fluoridation in the Virgin Islands is a topic requiring separate, intense study and discussion. Thank you for the opportunity to address you on this matter, and that ends the extent of my testimony.
Thank you very much, Dr. Molinar. At this time, we'll go to Dr. Grover. You're recognized for your testimony.
Thank you very much. Good morning, Mr. Chairman, members of the 34th Legislature Committee on Health, Hospitals, and Human Services, legislative staff, ladies and gentlemen. My name is Dr. Jane Grover, and I appear before you today in support of Bill 34-0051. First, let me thank this committee for allowing me to present my testimony, and I especially want to thank Senators Francis and Blyden for their leadership in highlighting this important issue. As the director of the Council for Advocacy for Access and Prevention for the American Dental Association in Chicago, it's my privilege to offer you some thoughts on school-based strategies to prevent dental disease and promote oral health. My dental and public health degrees are from the University of Michigan, and I was also grateful to be a faculty member there as well. After graduation and prior to coming to work at the American Dental Association 8 years ago, I was a dental director and clinician and an advanced education and general dentistry residency director at a federally qualified health center in Michigan, in one of the most underserved areas of Michigan. So I'm familiar. Unfortunately, I've seen extreme disease, dental disease in school children, and the effect it not only has on them, but on their parents who try to juggle job productivity and meet the needs of their children as well. I'm also familiar with an environment of high disease risk coupled with scarce resources, and that's why dental disease prevention matters, particularly in children. I've enjoyed meeting so many people in the several visits I've made to USVI, to all three islands since 2018. And in working with the Virgin Islands Dental Association members, we've seen the first steps taken towards implementing many of the practical goals identified by dental professionals to improve oral health, particularly with children. The overall goal of the 5-year oral health plan, adopted in 2019 by the Virgin Islands Dental Association, was to promote oral health among Virgin Islanders across the lifespan through a foundation of prevention, early detection, and treatment of dental disease with interprofessional models accompanied by timely treatment with accessible referral systems. And there is no better place to begin that than the school system to build oral health capacity, infrastructure, and true disease prevention. While there is currently a dental hygiene consultant from the Association of State and Territorial Dental Directors working with the Head Start population, and Charmaine Myers achieved greatness this year with her nursing team training in topical varnish application, coupled in the observance of the activities for National Children's Dental Health Month. It is now children from kindergarten through the 3rd grade that need a closer look. Due to infrastructure issues with the community water system in USVI currently, a fluoride-based fluoride rinse program, a school-based fluoride rinse program, makes great sense at this time to improve the oral health of the children, but also save you future dollars in expenditures for care. Any effective strategy, such as a school-based fluoride rinse program, will teach children the value of oral health while their teeth enjoy the benefits of stronger tooth enamel. The policy statement supported by the Association of State and Territorial Dental Directors states that the use of fluoride mouth rinse programs in schools is an effective prevention strategy for children aged 6 years and older when exposure to optimal systemic and topical fluorides is low and populations of children are at high risk for tooth decay, and there is demonstrated support by critical school personnel. In collaboration with the USVI health centers, a dental screening program, fluoride rinse protocol, and appropriate referral system establishment offers the opportunity to perform surveillance and needs assessment of this vulnerable population. An electronic dental record with documentation through a laptop computer would be established for each child, who would then receive necessary follow-up care they would need before being placed in a preventive maintenance program to avoid future disease. But at this point, without a school-based system in place, the dental professionals in the territory are just guessing at the disease level and treatment needs. A 3-year pilot program to begin this project, coupled with corporate support and volunteer efforts, would begin this pathway to health in a cost-efficient manner. Collaboration and data sharing between medical and dental service teams would help launch interdisciplinary care and assist health professionals with overall prevention strategies, including sealant and tobacco cessation strategies. I'm grateful again for the opportunity to present to you all today and look forward to answering any questions that you may have. Thank you very much for this opportunity.
Thank you very much, Dr. Grover. At this time, we'll hear from Ms. Zokai. You're recognized for your testimony.
Thank you. My name is Tuka Zokai. I am the prevention manager for the American Dental Association in Chicago. I have a master's in public health and a master's in population health, and I've worked with school-based health programs and over 30 fluoridation programs. It is my privilege to manage the National Fluoridation Advisory Committee and Prevention Subcommittee for the Council on Advocacy for Access and Prevention. And it is part of our purview to examine research relating to dental disease, presence or absence of fluoridated water, and overall oral health. While dental providers and pediatricians are working diligently to address disease in children, we look at the evidence to prevent the disease to begin with. When reviewing the oral health disease prevention opportunities in the U.S. Virgin Islands, we met with leaders in the community to identify where we can effectively prevent disease. We designed a unique plan to address disease in the community using the best evidence for effective disease prevention. This plan includes multiple facets, but today we can talk about the effectiveness of optimal community water fluoridation, fluoride varnish, and fluoride mouth rinse programs. For some background, fluoride is a naturally occurring mineral and helps remineralize the enamel of our teeth. It prevents cavities and helps teeth stay healthier longer. Water fluoridation began in 1945 in Grand Rapids, Michigan. And since that time, it has been heralded as the most cost-effective and most health equitable disease prevention strategy of the 20th century. The impact of water fluoridation on public health has been noted by the Center for Disease Control and Prevention, the National Institute of Health, and the American Association for Dental, Oral, and Craniofacial Research. Water fluoridation alone continues to reduce cavities by 25%. The recognition of community water fluoridation as a basic step in population health, particularly for children, is well noted. While we wait for the appropriate infrastructure to initiate water fluoridation in safe, clean drinking water, there are other evidence-based opportunities to offer fluoride to children. The essence of this bill would enable that step to be taken through school-based protocol, which would give young children the benefits of fluoridation as on their enamel of their newly erupting permanent teeth, would utilize this essential mineral as a shield against the dietary causes of tooth decay. This bill would increase the optimal exposure of fluoride to remineralize the enamel. And through programs such as fluoride varnish and fluoride mouth rinse, more optimal exposure can be achieved. School-based oral health programs have been shown to reduce cavities by up to 50%, 50. The ability to offer fluoride at the schools is not only going to prevent disease, but also decrease the number of missed school days and pain in children. I'd like to finish by sharing some history. Our first sign of civilization, according to anthropologists, is a healed femur bone, the largest bone in the human leg. A healed femur bone means another person had to bind the bone, carry the wounded individual, and help them until they were healed again. This was the first sign of civilization and population health. It was the sign of us taking care of each other. This bill is a continuation of that first step of compassion and communal health. The ability to prevent disease in our community, especially our children, is an important step we should take when we can. I encourage you to pass this amendment to the bill in order to move forward the health of the children in the U.S. Virgin Islands and offer a lifetime of stronger and healthier teeth.
Thank you very much. Mrs. Okai? Are you completed? I think you freeze up a little bit.
Yes, thank you so much for your time, and thank you for your notes at the beginning of this meeting.
Very well. Thank you very much, Ms. Okai. Next, we'll go to Dr. Taylor Griffith for her testimony.
Good morning, Mr. Chairman, members of the 34th Legislature, legislative staff, ladies and gentlemen. My name is Dr. Sonia Taylor Griffith, and I appear before you today in support of Bill number 34-0051, which would highlight the important dental consideration within the establishment of the U.S. Virgin Islands school-based health programs. First, let me thank this committee for inviting me to present my testimony, and also to Senator Marvin Blyden for sponsoring this bill. I am here as a practicing pediatric dentist and the current executive director of the Virgin Islands Dental Association to speak on the importance of oral health within the territory's school system, particularly for the children who are at high risk for contracting dental disease. History and science have established the value of community water fluoridation over the past many years. Since the beginning of community water fluoridation in the 1940s, experts have declared it to be the most effective, cost-effective, and health equitable public health practice of the 20th century. Fluoride in community water systems at the appropriate level as approved by the Environmental Protection Agency, EPA, strengthens tooth enamel, particularly in children, to help it be more resistant to tooth decay. Sugars and refined carbohydrates in a typical diet can create an acidic environment in the mouth, which causes serious erosion of tooth structure. This is why a fluoridated community water system would be helpful in decreasing the amount of tooth decay in the population. Due to the current infrastructure issues with the U.S. Virgin Islands public water system at this time, only an estimated 30% of our population drinks tap water. This eliminates the opportunity for the children and their developing teeth to benefit from the presence of fluoride in their lives. This is why a school-based rinse program would be so necessary for these children, and why Bill number 34-0051 offers such promise for better health. As a practitioner in our community for over 20 years, I have seen what the ravages of tooth decay can do over time to the teeth of our most vulnerable citizens. As it stands, our children have a lot of issues to manage, i.e. peer pressure, virtual schooling, just to name a few. Hence, something such as dental disease, which is preventable, should not be something that they should have to face. Oral health is part of overall health. Dental disease prevents proper nutrition, the ability to concentrate on studies, and can impede athletic performance. Part of a school-based health program should include dental screenings, assessments, and appropriate referral to a dental home for continued care. A school-based fluoride rinse program would be designed as part of a team approach through the Virgin Islands Dental Association in collaboration with the American Dental Association, the American Association of Pediatric Dentists, and the Association of State and Territorial Dental Directors. School-based rinse programs are present in many schools throughout the U.S., and the template for implementing a safe and effective protocol is well established. With the cooperation of the Department of Education, the students in the key grades, kindergarten through third grade, would be the first group to enter the school-based fluoride rinse programs on each island. In conjunction with the health center teams on St. Thomas and St. Croix, children would be screened, their dentition would be charted in an electronic dental record, their rinses performed, and they would be given a toothbrush, toothpaste kit, courtesy of some corporate partners who are interested in helping. The most convenient and least disruptive to classroom schedules would be a fluoride rinse program conducted weekly after obtaining parental consent. During the first year of this program, volunteer dental personnel would be utilized until protocols were established and the health center's team designs the appropriate schedule for each school. The Surgeon General's report identified school-based fluoride rinse programs as an effective strategy to prevent dental disease. This program also serves as an important component of the 5-year oral health plan approved by the Virgin Islands Dental Association to improve and promote oral health in the territory. Once again, thank you for affording me the opportunity to offer this testimony, and I would be delighted to answer any questions.
Thank you. Thank you very much, Dr. Griffith. And of course, oral health is part of overall health. Very salient point. At this time, we'll go to Attorney Tom Bolt. You're recognized for your testimony. Unmute your device and
Thank
speak.
you, Mr. Chairman, members of the 34th Legislature's Committee on Health, Hospitals, and Human Services. I'm Tom Bolt. And while I do serve as counsel to the American Dental Association and the Virgin Islands Dental Association, I appear before you this morning as chairman of the board of our local Salvation Army and a member of the Salvation Army National Advisory Board, both organizations working with at-risk children. Working with homeless and at-risk youth through the Salvation Army and its outreach programs, I have borne witness to the serious concerns regarding oral health of our youth. We have seen children in the Virgin Islands as young as 3 years of age with a multitude of cavities. Many do not know the rudimentary elements of oral health, let alone having a toothbrush or knowing how to use it. I support the testimonies of Dr. Jane Grover and Tuka Zakai and Dr. Sonia Taylor Griffin, but they are limited to the legislation before the committee this morning. And while Bill number 340051 is a start to saving the smiles of our Virgin Islands youth, we are ignoring the elephant in the room. To accomplish anything beyond a pilot project, it's imperative that we return to where we were as a territory some years ago, and restore the position of territorial dental director within the Department of Health. With the $71 million budget surplus that Governor Bryan noted this past week, and if we care for the health of our youth, now is the time to restore this critical position of territorial dental director. We cannot begin to have a public oral health program without someone in charge, without oversight over the programs such as the school fluoride rinse program, but also to ensure regulatory compliance, safety, and standards of care. Over a third of our youth qualify for Medicaid through our MAP program with the Department of Human Services and receive their dental care through our FQHCs, the East End and Frederiksted Health Clinic. One particular area of concern where we are not in compliance with federal law and in serious danger of losing significant federal funds for dental health care is from CMS, Medicaid, and our local program within the Department of Human Services. This program is designed to focus on oral health of our children, yet we in large part are ignoring that mandate and providing services that are outside of coverage, such as cosmetic dentistry for adults and providing implants as opposed to dentures. Currently, our Virgin Islands Medical Assistance Program, dental care, does not have a base fee schedule, a benefit package, a claims processing schedule, a credentialing program, or any form of quality oversight, which are all mandated by federal law. I note that the American Dental Association has volunteered to assist with these deficiencies, and recently an MOU with Dr. Alan Finkelstein was signed with the Department of Health. But we must move forward to implement these programs, which would happen if we had a territorial dental director who had oversight over the same. I thank you for the opportunity to provide some insight into oral health care for Virgin Islanders that are most in need. And if I can answer any questions you may have, I welcome the opportunity to do so.
Thank you. Thank you very much, Attorney Bolt. At this time, we'll go to the Frederiksted Health Center, Dr. Manuel or Ms. Sproul Webster. You recognize.
Yes, good morning, Honorable Senator Novell Francis and the committee members. My name is Dr. Dale Manuel. I am the Chief Dental Officer of Frederiksted Healthcare Incorporated. We're the sole safety net dental provider on St. Croix. I am here today to testify on behalf of the Board of Directors of the Frederiksted Healthcare, our staff, and our patients. With me today is Ms. Maseret Sproul Webster, the Frederiksted Healthcare Chief Executive Officer. And we'd like to thank you for the opportunity to provide Frederiksted Healthcare's perspective on Bill number 34-0051 and the proposed amendment to the bill. U.S. Virgin Islands is in the midst of a oral health crisis. The Henry J. Kaiser Family Foundation estimates only 32% of the oral health needs in the Virgin Islands are being met. Much of the needs is among our low-income residents. Frederiksted Healthcare is the only dental provider who accepts uninsured patients with a sliding fee schedule and is authorized to accept MEP patients. We estimate we're the only dental resources for at least 20,000 individuals on St. Croix. In 2019, we're able to provide oral health care to just over 2,900 individuals, a mere 19% of our target population. This presents a far worse picture of the oral health crisis on St. Croix than even projected by the Henry J. Kaiser Family Foundation. To address this mountain of need, the U.S. Virgin Islands government must use every available resource. This includes the use of fluoride in community water supplies to prevent dental diseases. Research indicates community health fluoridation is a major factor responsible for the decline in prevalence and severity of tooth decay during the second half of the 20th century. This is particularly true for children. At Frederick South Healthcare, we base our decisions on science, and we applaud the legislature for its move through bill number 34-0051 to lower the required minimum amount of fluoride in fresh water distributed for public consumption in the schools from not less than 0.8 of 1 milligram per liter to not less than 0.7 of 1 milligrams per liter to meet the current evidence-based standard published by the U.S. Department of Health and Human Services. This standard is designed to provide the health benefits of fluoride for preventing tooth decay while minimizing the chance of dental fluorosis, a condition caused by excessive fluoride ingestion, which can result in visible changes in tooth decay tooth enamel. This reduction is minimal and it falls within the guidelines of the EPA and the American Dental Association, considering the efficacy of supplemental fluoride when combined with fluoridated water. And we mean supplemented fluoride, access to toothpaste, prescription fluoride supplements, topical fluoride, those type of features. However, the territory faces a very unique challenge because over 50% of all our water consumption is bottled water or Cheston water. Therefore, efforts to reach the target population, school-based children will be missed. Additionally, too often, water emitted from the potable water system has a brackish color. As a result, it would be interesting to survey how many children actually drink from the water fountains in their schools. Subsequently, financial support should be given to WAPA and to any other agencies to correct their water distribution system and to maximize distribution of fluoridated water to a school-based population, utilizing standardized filtration and regulation systems. Fergus Healthcare also applauds the amendment to Bill number 34-0051, which includes the addition of a school-based fluoride rinse program for grade schools aged children, beginning in 2022 to the year 2023 academic year. School-based fluoride rinse programs are evidence-based to reduce tooth decay, which remain one of the most common chronic disease in childhood. The old adage, an ounce of prevention is worth a pound of cure applies here. Our only hope to address the mountain of oral health needs in our community is by reducing the size of that mountain. This begins with our most precious resources, our children. Every dental cavity prevented through a school-based fluoride rinse program is one less filling, one less root canal, or one less extraction later on. The amendment also includes language establishing the school-based dental prevention and treatment fund to support school-based dental screenings, prevention, and treatment programs. Frederick South Healthcare will take delivery of a mobile van later this year and anticipates the development of a school-based dental sealant program, which will include dental screenings, cleanings, fluoride application, and sealant placement. We urge the development of this fund and appropriation to it to support the operating costs of this program. The Centers of Disease Control and Prevention identify school-based dental sealant programs as an effective way to deliver preventive care and sealants to children who are less likely to receive private dental care. Dental sealant programs are cost-effective. Each tooth seal costs probably about $11, but the savings is significant as far as reducing the teeth from having root canals, which can cost upwards of thousands of dollars. Each root canal tooth require crowns also. So we're looking at probably $2,500 to $3,000 minimally just starting on restoring a tooth with a root canal. Hence, placing a sealant on that tooth can significantly reduce the cost of care. The CDC currently funds 20 states and territorial health departments to support school-based sealant programs. Puerto Rico currently receives $150,000 annually through these programs. Frederick South Healthcare urges the USVI Department of Health to seek similar fundings and pledge to work in collaboration on the development of grant applications to support these much-needed services. We also urge the legislature to appropriate other funds to this purpose. It's important to understand the significance of school-based dental education prevention programs for the territory. For many young children, this may be the only access to oral healthcare education, toothbrush kits, prevention services, screenings, nutrition and diet and counseling, topical fluoride application, cleanings, sealants, and even referral for advanced services. Early childhood caries is a preventable and should not have the detrimental effects on our children or the financial burden that we have. Early detection and early intervention are vital, and the school-based intervention gives us an invaluable opportunity to reduce the caries high-risk rate. Frederick Healthcare recognizes that a coordinated effort with an all-hands-on-deck approach is required to build a school-based relationship with students, their parents, teachers, counselors, nurses, administrators, primary care providers, and many others. We all have a role to play in this education, training, and support of these individuals for success. Through interactive online learning platforms, outreach efforts, PSAs, advertisements, local papers, publications, and classes, we will continue our current efforts. However, only a unified vision will assist all of our agencies, Department of Health, Department of Human Services, Department of Education, to coordinate our workflow and make an immediate and impactful improvement to our children's quality of life. While we applaud the Senate efforts to prioritize oral health care for the children of the territory, it's also significant to comprehend that children are directly dependent on their parents or caregivers for supervision and guidance. As a matter of fact, a parent or guardian is required to give written consent for their child to participate in most school-based prevention and education programs. The parental component has to be addressed for these programs to succeed. Parents must be reassured that their child will be safe and given the best care by competent and professional individuals. This trust goes beyond the typical teacher-student relationship. Parents must have confidence that questions and concerns will be appropriately managed and support is available when needed. The ability to communicate with parents and their children about oral health needs in a school-based setting will increase more children's access to care, prevent parents from losing work hours, and improve students' attendance. Most children learn from model behavior, and parents have a responsibility to help their children in these efforts. Establish mandates requiring our students to have oral and physical examination will encourage parents with compliance and adherence to education and prevention school-based programs. For example, the mandate that requires early Head Start students to receive a dental screening has significantly reduced the caries index in this particular group. Similarly, we'll find a reduction in early childhood caries if early intervention was performed. This comprehensive approach will yield the best results and support our students and their parents. I'd like to thank you for your consideration, and Ms. Webster and I are here to answer any questions that you may have for us.
Thank you. Thank you very much, Dr. Manuel, for your testimony, early detection, early intervention, key points. At this time, we'll ask the Madam Clerk to read the testimony that came from Commissioner Kazi Gomez.
Good morning, Honorable Senator Novell E. Francis, Jr., Chairman of the Committee on Health, Hospitals, and Human Services, committee members, and other senators present, my esteemed colleagues testifying today, the listening and viewing audience. I am Kimberly Kazi Gomez, Commissioner of the Virgin Islands Department of Human Services. I am unable to attend today's committee hearing, and therefore, I'm thankful for this opportunity to provide a written testimony to be read into the record. Specifically, in reference to Bill number 34-0051, revised on July 27, 2021, as amendment number 34-263, an act amending Title 19, Virgin Islands Code, Chapter 7.5, Section 4201, relating to fluoridation of water to lower the required minimum amount of fluoride in fresh water distributed for public consumption or for consumption in any schools in the Virgin Islands, sponsored by Senators Marvin A. Blyden and Novell E. Francis, Jr. Research states that it is certainly important for infants and children between the ages of 6 months to 16 years to be exposed to fluoride. This is the time frame during which the primary and permanent teeth come in. DHS has no specialized knowledge on this topic, and the proposed legislation does not directly impact our programs. However, since the bill is in line with the U.S. Department of Health and Human Services, DHS has no objection to the bill. I will also defer to the experts and my colleagues in the field who are testifying today. The Virgin Islands Department of Human Services is entrusted to serving our most vulnerable populations throughout the territory. Our ultimate goal is to assist our constituents from our littlest people through our Head Start program and regulating and licensing child care centers to our oldest people through our Division of Senior Citizen Affairs programs. Ultimately, hoping our clients achieve self-sufficiency through one or more of the 80-plus programs and services we offer. I would like to extend my gratitude to our dedicated Virgin Islands Department of Human Services team of professionals, the continued support of Governor Albert Bryan Jr. and Lieutenant Governor Tregenza Roach, as DHS continues to be committed to our motto, working together to make a difference. Thank you, Chairman Francis, for making this effort to ensure children are taken care of in our community.
Thank you, Madam Clerk, for reading that testimony from Commissioner Kimberly Causey Gomez from the Department of Human Services. Also, can you record the presence of Senator Sorrell as well as Senator Gittins? At this time, the committee will take a 2-minute recess, and then when we come back, we'll certainly open up the round of questioning, and we'll have 5 minutes from my colleagues in regards to questioning in respect to Bill 34-0051. Committee of Health, Hospital, and Human Services stand in recess for 2 minutes. We're out of recess. Again, I want to thank all of the testifiers for their testimony on Bill 34-0051. And at this time, we'll open up the round of questioning, and we'll start with Senator Johnson for his first 5 minutes. And thank you, Senator Johnson, for wearing your VI Madras tie. You're looking powerful in it. You're recognized for your 5 minutes.
Good morning, good morning. Good morning to our testifier. Good morning to my colleagues. Good morning to the people of the Virgin Islands. When I saw this bill, I must commend the sponsor of the bill, but I came down with a lot of different views and line of question. I wanted to start out with Mr. Noel Hodge. In your testimony, you stated to the ending part, the authority has contracted 7 Seas to fulfill the territory potable water demands utilizing the latest in reverse osmosis technology. This technology filters out impurities, resulting in undetectable level of fluorides. Can you expand on this a little bit more? Explain to me, and then I'll go to the other testifiers to ask a little more question about the fluoride in the water.
Yes. Good morning, Senator. So yes, the reverse osmosis process does filter out some of the naturally occurring minerals of the water. So you know that is a fact, and so that's why I mentioned that.
So at this time, who tests the water to determine the level of fluoride, if there is any?
We have internal lab personnel that collects, take samples and do analysis on the water. But you know, currently we do not test specifically for fluoride in water.
All right, so at this time you don't have no idea of what the level of fluoride, if there is natural fluoride in our potable water system at this time.
No, we're not collecting that data right now.
I'd like to ask any other health experts, anyone of the testifiers, what are the effects if there is excessive level of fluoride in the water? What are the effects? Dr. Gover, can you answer that? You're muted. You're muted, Doc. You're
Dr.
muted.
Grover, yeah, remove your device from mute.
Sorry. So with excess fluoridation in the water, there is a remarkable condition of teeth, which is fairly visible, and that is called fluorosis or mottling. And I would leave it to the experts, the practitioners who currently see children at this time, if they have noticed mottling or fluorosis of teeth. Some of this can be subtle, or some of it can be pretty profound. But given the information that we have so far, from a level of what level of fluoride is available in the water, I would leave it to the practitioners who have seen the children over the past several years, if they've seen any signs of fluorosis or mottling.
Dr. Dale Manuel from the Health Center, Frederickson Health Center, do you have any information on that?
Yes, thank you. It's actually just the opposite that we see. We see lack of, you know, because again, you know, there's a factor too that we didn't really speak about here in the territory. We're really an anti-fluoride community. You know, I'm part of the Rastafarian community, and you know, at the Rastafarian movement, they're very anti-fluoride. We're a very holistic community, so a lot of people are really anti-fluoride. So you don't find people even doing supplemental fluoride that much in our territory. So we really see the effects of lack of fluoride. You know, so it's not so fluorosis like Dr. Grover was alluding to earlier. Is you see the molten, or you see the weakening, or the soft and the white patches. We don't necessarily see those things. What we see more is just decay, rampant decay, where lack of fluoride is the issue. So the fluorosis is not the condition that we see at all. And like we testified earlier, because again, the majority of our population drink bottled water, they're not getting fluoridated water at all.
Thank you very much. And Dr. Sonia Taylor, can you give me a little bit of your feedback on that?
Yes, Senator. I concur with my colleague, Dr. Manuel. What I see as well is the lack of fluoride and what the effects of the lack of fluoride has in our community. Since I have been here for the past 20 years, I have not seen the effects of overfluoridation. I've seen the effects of underfluoridation in our community.
Thank you very much. And I'll wrap up with this question to the Department of Education. What would be the challenges that the department would find in carrying out this initiative of this bill? What would be your challenges?
Thank you for the question, Senator. At this time, we would need the proper guidance from the appropriate authorities as it relates to the fluoride in our cistern water, for example, the water that we do not get directly from the Water and Power Authority. That's number one from a structural perspective. Implementing the fluoride program, that would be, it wouldn't be as difficult to create a structure within. I think the monetary support of the program might be something that we have to discuss. We have a lot of emergency monies, federal monies, but of course, those are to reopen schools safely, not necessarily address a student program as such. But we can reprogram some of our CGA funds in hope that they can be approved to support this program, and of course, any outside sources of funding that we would have. So it would be more of the monetary, Senator, as well as the guidance to support our cistern water within our schools.
Well, thank you very much. And it would be good if we could start looking into it to see if some of those fundings can be definitely utilized. And again, I want to thank the sponsors for this initiative and this bill. It's very important when you see that the amount of young children that are lacking this opportunity for dental hygiene, it's important that we attack it from an early stage to make sure in growing up, dental community will be in a lot better hands. Thank you very much.
Thank you very much, Senator Johnson. Thank you very much, Senator Johnson, for your line of questioning. Commissioner, go ahead.
Yeah, I just thought it was appropriate to share because of the senator's question. At the VIDE, we began looking through our funding. We began reprogramming and asking questions to support the Department of Education's Eye, Ear, Mouth, Hands, and Heart program. And that is exactly, this initiative actually will support that program because we presented the whole child. We talked about supporting the development of the whole child, and that Eyes, Ears, Heart, Mouth, and Hands program is a part of that. So finding the funding, this might be the first program that we support because we're here at this stage. Thank you.
Thank you. Thank you for that, Commissioner. It's very, very important. Again, early detection and early intervention is the key to some of these issues. So thank you for that. And whatever we can do from the legislator to support your endeavors, and we are here to assist in that. Before we go on to the next senator, which will be Senator Carrion for his line of questions, I wanted to ask Dr. Molineux, you mentioned about establishing a baseline, a data baseline. Any suggestion on how you believe that could be achieved?
Yes, thank you. I think that was covered quite well in Dr. Sonia Griffith's testimony. She mentioned that they will be planning to have a series of screenings in the schools prior to the actual implementation of the fluoride muffins. So I think that has been covered, and I think that it's a fairly simple process. It requires manpower, of course, but it is a fairly simple process. I would like to also mention, if I may, Mr. Chairman, that in his testimony, Mr. Noel Hodge mentioned that reverse osmosis is still used in the purification system of the public water system. And in response to the question concerning the possibility of excess fluoride in the water system of the Virgin Islands, that was questioned, reverse osmosis removes fluoride and other hard minerals from water. So if we did have at present any fluoride coming through the pre-purified water, it is removed by reverse osmosis. So there is none in the public water system.
Very well, thank you for that. I don't know, Director Hodge, do you have any feedback to that comment, statement? You're on mute, sir.
Well, I think it's consistent to what I put in my testimony that the reverse osmosis system does filter these minerals to a large extent from the water.
Very well. Then the need for us to be able to make sure that those are put back in and by some process. Senator Carrion, you're recognized for your 5 minutes.
Good morning. Good morning, Mr. Chair. Good morning to my colleagues. Good morning to the viewing and listening audience and to the testifiers. This morning we have a whole full group of individuals testifying today. So I want to start off by commending the sponsor of the bill. I do believe that oral health is of utmost importance, and any way we can to be able to promote, educate, and facilitate this is necessary, and we must move in that direction. And I do have a few questions I would like to ask. I think I would like to start by a very general question. First of all, any of the testifiers have any concern whatsoever with regard to this bill? Are there any concerns? I guess not.
Well, this is Commissioner Encarnacion, if I may.
Mm-hmm.
I don't have concerns in reference to what the bill is requesting, because I think it is a standard that I think that we need to meet throughout the territory and throughout the nation. The only concern would be the implementation of the bill, looking at one who has the authority of actually injecting the water with fluoride. Of course, we know DPNR and health in the different categories would be the responsible person for and hold the criteria for actually assessing the level of fluoride in the systems in both the municipal as well as the private cisterns and wells on an ongoing basis. The implementation portion of it is what my concern would be. And of course, there's another conversation that's occurring, and that is the program part of it that is actually going to increase the number of fluoride or percentage of fluoride that our children are exposed to, that I think is actually right now a more critical portion of what we can do in lieu of the water not actually having fluoride in it. So the bill itself is good, but the implementation of the bill, I think there is a concern.
And I thank you for sharing that with us, Commissioner Encarnacion, because I agree with you, and I think that's one of the problems sometimes we have with some of our bills, implementation portion of it. Now, following that same line, I would love also to have had DPNR present so they could also speak about what you mentioned, being able to test the water and make sure the implementation process of it. But other than that, what is the appropriate infrastructure necessary to be able to initiate this bill, especially in the area to have safe, clean drinking water, water fluoride? What's the infrastructure that we need to have in place? Anyone?
Morning. Noel Hodge, WAPA. So we will need to have like an injection system. If we're going to inject the portable water system, that would have to be installed. And then there's also the need for WAPA and DPNR to establish the protocols for the sampling, the analysis, the data collection, the reporting. All of this has to be memorialized in our operating document, which has to be approved by the EPA. So, and then of course, to the extent that we need additional resources to do the additional sampling in the field and at the various sample stations throughout the water distribution system, that has to be looked at as well. So those are some of the things that would need to take place.
So we need to have the proper infrastructure in place. Now, just roughly, because there's a cost associated with having that proper infrastructure, and I guess what you're referring to, that injection process has to be done once the water has been processed, because your processing system then will eliminate the fluoride that is placed in it. So it has to be done after it's been purified or filtered, and you have a subcontractor that does that. Oh, so what costs do you believe, I don't know if you've looked into it since receiving the draft of the bill, but what costs do you associate to having the proper infrastructure in place?
We haven't come up with a cost yet, but that's something that we can and will work on.
Okay. I think that's an important component to this. So that's why I went that direction. Now, the Department of Health, I realize that from Attorney Bolt's testimony, he did point out some things that are crucial to have within our structure. And one of the things that he mentioned was having a dental director. When was the last time we had a dental director? And why was that position taken out of the budget?
So of course, Senator, that predates my delegation. Basically, it predates my history in Department of Health. However,
1 minute.
Just looking at what we did before, I was actually part of the conversation in terms of dental health, not just from a pediatric standpoint, but an overall dental health standpoint in relations to New York University has now taken it over, but Lutheran Health in New York actually worked with us at the hospital when I was there. So I'm very familiar with what is going on. So we just really need to reestablish a program. And I think what Dr. Mayers and the MCH program is actually beginning is one step to getting there, especially in the pediatric population, looking at 0 and older. And so we've already started that. But I have to say, I really recognize Mr. Krieger and Senator Biden for calling a meeting prior to this hearing to discuss, and we all had an opportunity to speak about the program and bringing back a territorial dental director to really create and work collaboratively with everyone within a territory to make this successful. So that's something that is not put back on the table, and we will be discussing how we can actually implement that. So it's up for discussion, sir.
Well, I'm glad to hear you guys are having those conversations, because I also believe is crucial.
Time.
And maybe that's one of the reasons that we have the issues we have, the lack of oral hygiene within our territory, not having it organized and properly structured and coordinated. Having a state director, I think, is important, and we must have that in place. So I commend you for having those conversations, and I look forward to seeing this implemented and reinstated within the department. Thank you, Mr. Chair.
Thank you very much, Senator Carrion, for your line of question. At this time, we'll go to Senator Francis Heiliger. You recognize for your 5 minutes.
Thank you. Good afternoon. Good morning. Good day. Welcome to my colleagues, testifiers, people of the territory. I'm going to ask just some basic common sense questions quickly. Has anyone done any research in regards to, as it relates to, for example, and WAPA and their potable water, do people even drink it? And if they drink it, what preparations do they make at home? For example, boiling this water, would that remove the fluoride and make this entire conversation moot when it comes to that aspect? Anyone?
This is Tuka Zokai from the American Dental Association. In terms of boiling the water does not remove the fluoride concentration. It could actually very slightly increase the concentration in terms of the parts per million. But the way to remove the water would involve a reverse osmosis, which could happen if there's a reverse osmosis filter being used, but a typical like Brita filter does not involve reverse osmosis. So it filters the water while retaining the fluoride. So that's the scientific background, but I'm not sure if someone else can speak on the number of folks that do drink the water. That's also why we are encouraging other fluoride interventions until the infrastructure for properly treated water is also implemented.
Well, one of the things that I must note on a national basis where they speak about putting fluoride into the water, a lot of these different states and counties have like one major water source. Here in the Virgin Islands, we're not set up that way. We could touch on individuals that utilize WAPA, and then you have a large part of the population that also utilizes their own personal cisterns. And for me, listening to this conversation, it boils back to quite a bit of infrastructure and public education, and wondering in regards to how a lot of this will even potentially be implemented. I understand when certain things are done on a national scale, but being here in the Caribbean and the way we're set up, some of these things might be a little bit more difficult to implement as opposed to other places. How do you intend on tackling this? Could you share that with me?
Again, others can speak to that more. It's also part of why when we originally came together, we were just talking about water fluoridation. But as we looked at these important issues that you're also highlighting, we said that there are opportunities for more school-based health programs that involve fluoride mouth rinses and encouraging more pediatricians and offering that education to offer fluoride varnish. But if there's a population that is being served the potable water, that would have the optimal amount of fluoride as well, but it's not the only intervention. So for those that are utilizing cisterns, for example, that there are other sources of fluoride if it's not from that specific water system.
2 minutes.
So it's a multifaceted approach.
Please put on your camera.
Oh, yes, of course.
You testified from currently what's the testimony from WAPA is because of the reverse osmosis, there's no real detection of fluoride in the water. We don't have a plan for implementation via cisterns as yet because we now have to look at that infrastructure. So we're attempting to amend something that really currently doesn't even exist. And I am fully in support of bringing things in line nationally, but I also would like to make sure that we're doing bills that deal with the very infrastructure in the first place to even get it implemented before we're amending levels for something that really doesn't exist here in the territory. So that's where my concern is. I am fully in support of the public education aspect of it. I think that aspect that was discussed as it relates to giving children more information, getting individuals into the schools to help deal with dental hygiene and teaching and education, I love that part. But I also have to be practical as it deals to the other part and also look at the dollars and cents of what would it take to implement this in a community that is structured the way it is. We don't have a single source option. We have multiple sources. We really don't drink the potable water like that. A lot of people purchase bottled water to drink. They just don't use the potable water for consumption. So it's a lot of things that have me questioning how would this be implemented and the cost. And that is very important because as a legislator, we're responsible for the purse strings. So how much is it going to cost public education and really getting our children involved in making sure they understand the hygiene part and understand the plus of having fluoride in their system to assist with their teeth, et cetera, as opposed to us figuring out how to implement this through the water. Based on our community, which one would be best suited for us? Mr. Chair, could I finish?
You may wrap up, Senator.
Thank you. And another aspect of it when it comes to education, I think we also have to focus specifically, even as a government, one of the things that I think we have to do better at is in negotiating the dental aspect of our contract with Cigna. I mean, it is very limited where someone might have to have a procedure that is $3,000, $5,000, and we're limited to what, 12 or something like that, 1,200. So I think there's many aspects, not only from a childhood standpoint, but I'm more leaning towards the educational part and making sure our children are healthy from that aspect and moving from there. So thank you, Mr. Chair, for sharing your thoughts.
Thank you.
Or
Thank you
giving
very
me
much.
this opportunity.
Thank you, Senator Francis Heiliger, for your line of question. At this time, we'll recognize Senate President Donna Frey Gregory for her 5 minutes.
Thank you, Mr. Chair, and good morning to my colleagues, and good morning to the testifiers. I commend the sponsors for bringing this legislation forward because I believe that this is a very important discussion to be had here in the territory. And I do recognize the challenges that we have with dental hygiene and the opportunities for us to have water fluoridation. However, based on the challenges that we have with the Virgin Islands Water and Power Authority and the fact that many of us do not, those of us that get the city water, if you will, do not drink the city water, and those of us, many of us have cistern water. The question that I have, because I've seen the amendment, and I think that the amendment to this legislation is most definitely moving in the right direction. I need to ask the Commissioner of Health, what would be the challenge outside of funding for the implementation of the fluoride mouth rinse program in our schools?
This is actually a very early conversation, so I would actually have to ask those in the ADA to actually provide more of that information. We just started that conversation. Very interesting conversation to have, but if looking at that funding source and finding the funding source, requesting some funds from the legislature as well, and putting everything together, but you're looking at a territorial director as well as outreach workers to ensure that it's done, collaboration with Department of Health, Education and Human Services, as well as the federally qualified health centers to see exactly how we can come together. I can actually work with them and prepare a cost for you, ma'am.
Okay, so we currently don't have dental health screening and prevention programs in our schools, correct?
Correct, Senator.
And Dr. Molinar is on the on this meeting, correct? Dr. Molinar? So
Yes.
Dr. Molinar, back in the
Yes.
day, we had a program for at our schools, I remember. I don't know how many of us are old enough in this room to remember that, but there was a program for, it was called, I think, Dental Health and Screening and Prevention Program that we had in our schools where from time to time, Department of Health would come in, I guess, through the MCH program, and they would give screening, provide screening to the students, and then give you a little packet that you're really excited about, your little toothbrush, your little toothpaste, a little tube, and all that good stuff. So at some point, of course, that program went away. And I guess based on this legislation, and I do agree that, you know, this is a very important discussion that we should have because there's so many health challenges that we have in our community, and we could harken back a lot of the health challenges to our mouth. So tell us, what would be, and this is I guess this goes back to you again, the Commissioner of Health, what would be the challenge with re-implementing that program within our school system? I note though that in the amendment to the legislation that we only spoke to K4, K3, and I really think that we are at the stage where we are dealing with, in our public schools with pre-K students as well. So if we are to move this legislation, we need to add pre-K. But tell me, Commissioner, outside of funding, what would be that challenge from the MCH division?
Well, it'd be more than MCH because you're talking about 0 to 3 as well. And so that would be the infants and toddler program, the WIC program, as well as MCH. All of those, of course, go under the public health.
Commissioner, not 0 to 3. I was specific. pre-K. So pre-K for us is 4-year-olds. 4-year-olds, 5-year-olds, 6-year-olds, up to the 3rd grade.
So I don't think it'll be much of a problem because we've already begun the work in MCH. So really and truly, it goes back to having an organized person to complete that operation, the programmatic portion of it. So it's just starting the work and getting it done. I don't see that much of a challenge to it at all.
Well, then I'm going to ask you this last question. I think what's also always important as we move legislation is buy-in from the entity that's responsible for the implementation. So what is your level of buy-in on this particular measure with the amendment, of course, because we've already talked about our challenges with our public city water systems in the Virgin Islands, and I don't know if you want to extend to require households to put fluoridation in their water. So, you know, what is your buy-in from the perspective of ensuring that our schools have the fluoride mount rinse program at the pre-K, which is the 4-year-olds to the 3rd graders in our school system?
100%. Public health is all about preventive health. So of course, 100% buy-in.
Okay, good. Mr. Chair, I really don't have any other questions. Oh, I do have a question for WAPA. How long is the 7Cs contract? When does that expire?
Attorney Sinclair is on the line. So, can you research that?
Yes, I can. Good morning, all. I can. I don't have that before me, but I can look that up and get back to the committee.
Okay. So while we're trying to look that up, let me just ask. I know that, well, part of the recovery efforts is to replace some of the water lines. Is that correct, Executive Director?
Yes, Senator.
Okay. So with the replacing of those lines, what are the discussions with around WAPA as it relates to continuing the relationship with 7Cs? Because as we ask around in our community, there's really no true answer as to why the Virgin Islands Water and Power Authority went with 7Cs or outsourced rather their water system in the first place. So is there any discussion around bringing that back in-house at some point?
Senator, we haven't had that discussion. However, at the time when we were ready to renew, we need to definitely look at doing another competitive bid, looking at that possibility. But for now, there's no discussion to bring those types of operations back in-house because we no longer have use of the access to low pressure steam to produce water the way that we did in the past, and then the capital cost to install our own reverse osmosis system, we would have to take that into consideration. That would be a considerable capital cost for WAPA at this point.
Well, my time has been called, Mr. Chair, and I don't want to abuse my time, but of course, the responses that was given by the Virgin Islands Water and Power Authority is not satisfactory because we know that there are millions of dollars to address our water lines in the Virgin Islands. As we address them, consideration needs to be given to all things around this water system, to include moving the system back in-house. Thank you for the time, Mr. Chair.
Thank you very much, Senator Fred Gregory. Next, we'll go to Senator VLA, and then I'll allow for, once he completes, I'll allow for the ADA to speak to some of the resources that they could bring to bear to assist us in the implementation of this measure. Senator VLA, you recognize for your 5 minutes.
Thank you, Mr. Chair. Good morning to the people of the Virgin Islands. Good morning, colleagues. Good morning to the testifiers. Mr. Hodge, the 7Cs contract is what, 20 years?
Yeah, our attorney is looking up the information, so I'm sure she'll have that information shortly.
Yeah, I think it's a 20-year contract with an option for an additional 20. So we sold what we own a long time ago with these bad decisions that have been made in the Water and Power Authority, and then dismantle our our desalinization plant, and went into this reverse osmosis that is producing brown water by the time we reach Frederickson, because it's a totally different process. I really wonder how that has financially helped the Water and Power Authority when we're paying an entity to produce water and not producing it ourselves and selling it to the consumers. Do we make money on the water part of the at WAPA, or are we losing money every year?
We do make monies to cover our operating and some capital projects.
Are we current with our payments to Seven Seas?
I believe we're about probably 2 or 3 months behind currently, but we are making payments.
Okay, I mean, today is about a bill that I'm going to support. I'm in support of it, but you know, there is an opportunity here with the Water and Power Authority before us to ask certain questions. And I had a conversation this morning, and I just questioned as to what is our 26 cents base rate really being utilized for, when yesterday we heard from the government employee retirement system that we're not paying employer or employee contribution. Just putting on the record publicly, 26 cents for base rate is higher than every single state base rate plus cost of fuel, to include Guam and Puerto Rico. So at some point, somebody in the Water and Power Authority is going to have to answer as to what they're doing with the millions of dollars generated by 26 cents. 26 cents, you're supposed to be able to efficiently operate and maintain the plants, and St. Thomas is literally falling apart at the seams. I just want to publicly put that there on the record. At some point, things in the Virgin Islands got to change. This pacifying WAPA all the time, something is wrong with that. Something is terribly wrong with that. And I'm eagerly awaiting to see what is going to be the story now, since those two bills receive an override. Commissioner of Health, Ms. Encarnacion, you know, we're going over this bill, and I'm just sitting here and saying, what really happened to the way that public health function in the Virgin Islands? Because along with receiving dental care, you used to come into the schools and check your eyes. That is how I knew that my vision needed wear contacts. That's how I knew I needed to wear glasses. But I don't understand how back in the 70s, this government was so efficient in meeting the needs of the community, to include having a public health program, immunization, dental eye screening, going into schools on a regular basis. And we fast forward to 2021, in the age of technology, and those services have just basically fell apart. Is there any effort to once again put together a public health program that goes into the school for dental and eye screening, et cetera?
We actually have begun ear screening. Hearing screening definitely is being done on a quarterly basis in all the schools. And so that's definitely started. Of course, I'm a big believer. We have to go back to see what actually worked. Sometimes people indicate that we have to put the past behind, but I think we need to look to see what worked before. And I agree with you. There's some things that needs to come back, and assessments need to be conducted. Public health is actually not all about doing it, but making sure that it's done. Correct. So collaborating with the federally qualified health centers, as well as other community-based organizations, is critical as well. And so that is the trajectory in which we're going.
And we need to move in that direction, because we can see the direct reflection of not having that public health component when we get the numbers from Frederickson Health Center in reference to the number of individuals who are waiting a dental appointment. So we got to go back to what worked. We had excellent public health nurses in the Virgin Islands, and on our island, and St. Croix for sure. We had so many individuals that just went above and beyond and made sure that they took care of us when we were young. in terms of making sure our eyes, our ears, dental were all up to par. For one of the specialists, does the bottled water that we purchase, does that contain fluoride?
Go ahead, Tuka.
I'm sorry. May you repeat the specific question?
Does bottled water that we purchase in the stores, do they have that 0.7 fluoride content?
Thank you. Let me also turn on my camera. The bottled water depends on which brand is being purchased. Now, we have a link, I can share it with you, from the International Bottled Water Association that lists the different brands that do have fluoride. However, it is not a requirement to share the amount of fluoride that is in the water. So we do not know if it is an optimal amount of fluoride or not. There is some hypothesis that a lot of the bottled water actually has higher concentrations than 0.7 parts per million if they are untreated, like unreverse osmosis treated spring water.
One second.
Ms. Zokai.
To your knowledge, do you know if any tests have been conducted on the local bottled water in reference to the fluoride content?
I'm not sure about local bottled water. It depends where it's being bottled from.
No, I'm speaking more about the gallon bottles that are produced locally in the Virgin Islands. I'm wondering if does it make sense? Does it make sense to require that you know the fluoride content to know whether or not the students are receiving, our children are receiving the adequate amount of fluoride on a regular basis?
Right. Ideally, it would have been tested if it's locally bottled water, and I'm not sure the process for the treatment. That would be someone who is more local to water treatment that could speak to that. However, from testimony from the medical and dental professionals, the concern is actually the lack of fluoride exposure due to dental decay and the no sign of fluorosis.
Okay. Commissioner Education, Ms. Barry Benjamin, I know we hire a company to test the water in the schools on a regular basis. Do you test the fluoride content? And I know we chlorine on the waters in our system. You have somebody that goes around to the schools and make sure there's sufficient chlorine in the system. But do we test the fluoride content?
Thank you, Senator. And Mr. Sibley will respond to that question.
Yes, good afternoon, Senator. Joseph Sibley, Territorial Facilities Manager. No, we do not test for fluoride in the water. We test for the chlorine content and other chloroform, E. coli, and those type of diseases.
Do you believe that should be outlined in this bill, that we need to test for fluoride to see exactly what our students are drinking on a regular basis, or you leave that alone?
For me, I believe we should test for everything. I don't think there's any content. There's no chlorine, no fluoride right now, but that's not for me, I think, to make that call.
Okay.
To answer your question, yes, Senator, it should be tested.
Okay, thank you so much, Mr. Chair. I would like to end by saying the last part of this amendment creates a fund. And if we're going to get it started and have the expectation that they started, we're going to need to provide some funding so that we can get it started. Thank you so much, Mr. Chair.
Thank you very much, Senator Viola. Point of entry, inquiry, Senator Fred Gregory.
Thank you, Mr. Chair. Just for clarification purposes, I thought that I heard the Virgin Islands Water and Power Authority indicate that they do not have fluoride in the water. Is that accurate? I'm asking a question based on the previous speaker's question and the responses that were provided by the Department of Education. If they don't have fluoride in the water, are we testing for fluoride? I'm not following. So is it something that I'm missing?
If I may.
Not education. WAPA, could you verify that, please?
Okay, yeah, I have our COO for the water distribution system, Mr. Gregoire, on the line. Go ahead, Mr. Gregoire.
Yes, good afternoon, Senators. Don Gregoire, interim CO for water systems. We do test for fluoride. We have every 3 years, we have, it's called an inorganic contaminants test that we do test for fluoride. And based on our reverse osmosis system, like we've said, in previous testimony, it's the traces of fluoride in the water it's almost untraceable. So we know for a fact that, based on our reverse osmosis system, we're not really, the fluoride content is not even close to what we're talking about today.
Okay, thank you. So coming out the gate, coming up to the schools, the fluoride content is not there. So why would we be spending money to test for fluoride? So that's information that WAPA should be providing to the Department of Education as it relates to the fluoride content out the gate, so we could have that information up front. We should not be spending money for that particular purpose. What we need to do, as I said earlier, is really give consideration to the in-school programs. And I have one other point, Mr. Chair, and that is, and that's for Dr. Molina. Dr. Molina, there is a program or a procedure, that's the word, where you seal the back and upper molars of children. Is that program or is that procedure still a procedure that they use in the dental field? Because I know that when my kids were growing up, that's how I was able to save their teeth. I had their molars, upper and lower molars sealed.
Yes, Senator. You're speaking of dental sealants.
Yes.
And that process, that procedure is still commonly practiced. It's a good preventive measure. However, it seals only the chewing side of the teeth. You mentioned molars, those are the big back teeth.
Mm-hmm.
It seals only the chewing surfaces of the teeth. It does not seal, it cannot seal the other surfaces of the teeth that are more prone to decay. But it is a commonly practiced in the Virgin Islands. Most dental offices do it. We do it at CMCC, and I think that Frederiksted as well does it.
All right, thank you.
As I mentioned in my testimony, we did some of the preliminary testing of the dental sealants in the beginning, back in the early 70s, late 70s, pardon me.
Something that was said earlier today in regards to the issue of individuals going into our schools, I still think that I saw some major initiatives that have been done by some of the private dental office, as well as I think the Frederiksted Health Center, maybe STEAM, where they actually continue to go into the schools and provide some dental awareness. Is that not the case, Department of Education, Commissioner, in respect to that? Because I know that there was some initiative most recently in the last few years by which private dentists, as well as I think our Frederiksted Health Center, have gone into the schools to bring about some awareness. Are you aware of those?
Yes, Senator. As recent as last year, we had a partnership with Colgate where virtual oral hygiene classes were held. I'm not sure about the Frederiksted initiative that you mentioned, where our K through third graders receive packages with Colgate products. Pearl B. Juanita and Alfredo were beneficiaries of that initiative, and that's the recent initiative as of last year. But holistically, as I mentioned earlier, that is the purpose of our Eyes, Ears, Mouth, Hands, and Heart program. And the Department of Health is one of the partners that would help us to actually realize that program so that we can. I was a beneficiary of the program years ago where you received, your toothbrush, your dental, your eye vision screening, mouth, etc. So we are definitely getting those services back into our schools.
Very well. Thank you for that. Senator Soror, you're recognized for your 5 minutes.
Thank you, Mr. Chair. Good morning to our testifiers. Good morning to those listening and viewing. I think this discussion today points to a larger picture of our public health or our healthcare system in general. And when we say system, of course, public education, human services, Department of Health, private providers, hospitals. The system is somewhat kind of broken, and we're talking about fluoridation of water in schools, but even down to public school nurses, that's an issue too, you know, and I think the commissioner can attest to, of course, there are issues there, no fault of your own, but we have a shortage of nurses as well in schools. Commissioner Barry Benjamin, the implementation of this bill, has this been a part of the discussion for the new schools?
No, Senator.
Some of the new schools are going to have their systems, right?
Yes, Senator.
And in Commissioner Encarnacion, is there any federal funding to support this project, like a grant?
Yes, we actually got some grant from Title V, which actually goes out of MCH, and MCH and Dr. Mears did indicate that she's also requesting further funding through Title V to support the initiative.
Okay, let's go to WAPA briefly on page. The testimony isn't numbered. Last paragraph, page 1, the last paragraph. So you said, under the current operating guidelines mandated by the EPA and the Department of Planning and Natural Resources, the authority is not mandated or required to inject fluoride in the potable water system. As such, the authority does not utilize fluoride in their day-to-day water distribution operations. And then when you go to Title 19, Section 4201 of the Code, the language says that any governmental agency or instrumentality, persons, firm, or corporation having responsibility for the production and or distribution of fresh water for public consumption or for consumption in the schools, whether publicly or privately owned or operated, shall control the quantity of fluoride in the water so produced and or distributed to maintain a fluoride content of not less than 1/10 of 1 milligram per liter, no more than 1 2/10 milligram per liter. So the question I have is, do you not think the code applies to you?
Good afternoon, Senator. I'll allow Attorney Sinclair to speak to that.
Good afternoon, Senators. At the time that that was enacted in the code, the water system was under DPW. At the time WAPA took over the water system, there was no provision for fluoride in the water.
Please put on your camera, Attorney. Please put on your camera. Thank you.
Oh, I'm sorry. I'm having some communication issues, so forgive me if I freeze. Let me see. Yes. When we were first presented with the first version of the bill, we actually reached out and tried to understand why the fluoride was never put in the water, and they were unable to let us know. So the system was taken over, and we went from what it was in hand.
So this was enacted in 1975. That's the date of the code. This is Act number 3757 in 1975. So when was WAPA established? When did water come under your purview?
I don't remember the exact.
A long time ago.
It was years after.
87. That was 1987.
Okay,
Senator Don Gregoire, 1987.
Okay, so from 1987 to now, that cannot be the answer, Attorney.
What I'm saying to you is that there was no, from what I understand, there was no.
It's okay. It's okay. It's okay, Attorney. It's okay. Thank you.
Put in place to add the fluoride.
Thank you for your response.
The system was taken over.
Okay, thank you for your response, and I can't buy into that because the law was enacted in 1975. Water came under your purview. We had ample time through the many reforms that we've had to at least begin a phase-in process of adding fluoride to water. Department of Health Commissioner Encarnacion, In your testimony, you talk about shared responsibilities that should be with health and should be with DPNR. You want DPNR to promulgate rules and regs, and you want for health to test the non-municipal sources such as cisterns and wells. Now, so often in government, we function in silos. Do you not think that they should be consolidated under one agency, whether it be you or DPNR?
2 minutes.
I was actually just going by really and truly what the code says currently. So code says, and I did speak with Commissioner Oriol, and he indicated what his responsibilities are. Whether or not we merge, I don't have an opinion in reference to that. It may assist, but DPNR does control the municipal portion of it, and we control the non-municipal portion of it in terms of regulation. So whether or not it merges, it's okay with me, but right now that's how it stands.
Okay, I understand how it stands, but do you agree with consolidating the functions of this bill under one agency?
It would be helpful to have one agency doing it. Health can actually pull the data and evaluate and make recommendation based on what the data says.
Okay, thank you. And let's go to the doctor briefly. Any doctor. Do we have a doctor that's there that's not a dentist? Okay. Let's go to the American Dental Association then. In adults, what are some of the illnesses that you see, or not mental health, or the health issues that you see that may be rooted in poor oral health?
1 minute.
Well, Senator, I'll offer a couple comments, and then I'm sure Dr.
Please give your
Taylor
name
Griffith
quickly.
would add.
Please give your
But,
name before speaking.
Hi, this is Dr. Jane Grover. So the emerging science shows that not only in pregnant women, their birth outcomes are improved with good oral health, but also chronic disease management, such as cardiovascular disease and diabetes, is better controlled when those patients have a healthy mouth. And that includes restorations and periodic exams and cleanings. I'm sure Dr. Molinar has seen this firsthand at the health center. I know I did. And Dr. I'm sure Frederickstad also has patients that are adults that see the improvement in their overall health when certain issues are addressed, such as, profound infection, which impacts overall health. Thank you.
Thank you for that. And Mr. Chair, my time will be called like in 5 seconds. Time, right? And just as I may conclude, I am in support of the legislation. I am in support of the amendment. But I have to express my disappointment in WAPA. Every time they come before us, it's like resistance, board change in WAPA. You asking about fluoride, comes this hogwash story of, the code so that we're not mandated to do it. And the code does mandate them to do it. Then to say it was under DPW, but then water came under WAPA in 1987, still no phasing. I mean, it does frustrate you with the utility. And Mr. Hodge, you came from water. So I don't understand who gave you this testimony to read, but Mr. Chair, I won't belabor the issue. It's just frustrating on a WAPA portion, the responses that they continue to give this body. Thank you for the time.
Thank you very much, Senator Sarro, for your comments. Next, we'll go to Senator Gittins. You're recognized for your 5 minutes.
Thank you, Mr. Chair, and good afternoon to all. I actually like the conversation today. However, I too have some concerns, and my colleagues this morning or this afternoon are on the ball. As every speaker that mentions something, it just rings off a bell or something that I also thought of. And again, the previous speaker just showed we're talking about legislation that was done back in 1975, and the Good Finance Chair even spoke to that as well earlier. That caused me to wonder whatever happened to our public health and dental health initiatives and commercials that we used to see as children, and the Senate President also spoke to that, and I had a little chuckle there earlier. You know, not seeing or hearing these types of commercials or initiatives truly make me feel as if we're regressing rather than progressing as we discuss this specific topic. And I'm also wondering, why are we legislating this rather than simply just setting the standards to meet that of the federal guidelines? I was also looking at the Water and Power Authority's statement that was just recited by the previous speaker as well, and that truly concerned me. Besides the statement, I'm saying, why even mention 7Cs? Before 7Cs came around here, we had good water running to our homes. And since we're spending these millions of dollars, I don't know what crap we're getting in our homes at this time. So we could have saved the statement of even talking about having contracted 7Cs to fulfill the territory's potable water demands, because I truthfully don't believe that it's fulfilling that. And colleagues, at times, you know, we're having some discussions and we go above people's heads, and we're talking about our children and their dental hygiene and whatnot. But as we talk about fluoridation, how much people know what's fluoridation? I mean, we're discussing this, and our youngsters probably don't even know what it is that we're discussing. But we have to make sure that the community knows that we're talking about a control adjustment used in public health, in public water supply rather, solely to reduce the tooth decay. And we have to explain these things and break it down so that those, especially who are directly affected, can understand exactly what it is we're talking about. Some other concerns. I really need to know, what is the true state of our potable water at all our schools? And what is the water source at our schools at this time? Can Department of Health, Department of Education, let me know, please. Mr. Sibley there?
Yes, good afternoon, Senator. The water sources from the school in the St. Thomas district, all of our facilities except for 3 receive direct water from WAPA. In the St. Croix district, all the school facilities receive water from WAPA distribution.
So both are from WAPA then?
Yes, sir. Except in the St. Thomas district, we have 3 facilities that utilize the cistern water.
You have 2 facilities out of how many utilizing cistern water?
I have three facilities out of 34.
3 facilities out of 34.
That receive, those 3 receive water from the cisterns.
Okay, so 3 from the cistern and 31 from WAPA, correct?
Yes, Senator.
How often is this water tested and by whom?
The water is tested monthly by Ocean Systems Laboratories.
2 minutes.
And do all our schools have drinking water fountains?
Yes, Senator. Although right now we are converting those to bottle fill stations.
All of them will be converted to bottle filled stations?
Yes, Senator.
And this is filtered water bottle you're talking about?
Yes, they have a component of a filter within the bottle fills.
Who is the company again? you stated testing. Who is the company against it? You stated testing on a monthly basis?
Ocean System Laboratories.
And is this in both districts?
Yes, territorially. They're the only company on the islands in the territory that does the testing.
And the Department of Health, are you at any point testing any of these waters? Because as I look at the legislation as well, Section 4203 speaks to the responsibility of, for administration and enforcement, and the Department of Health is responsible for that through this chapter. Are you able to fulfill these functions?
I have Director Harris, who is the Director of Environmental Health. So he can speak to the non-municipal portion of what we do test, if any. Director Harris?
1 minute.
Good afternoon, Director Harris. Senator, to answer your question, we don't test water. We request for record keeping of the water from being tested from the labs. That's from the non-municipal source.
Okay, I'll suggest to the Department of Health to review your responsibility under Title 19, subsection 4203, which again speaks to the responsibility for administration and enforcement. Before my time is come, Mr. Chair, I also wanted to ask Department of Education Commissioner, there was a mention earlier as well about the shortage of school nurses. Are there any consideration for any alternatives for school nurses? I know that nationwide we have a shortage of nurses, but are we looking at any alternatives? As I've told you before, I've submitted legislation to look at school resource medic or a school health technician. Have there been any discussions whatsoever with regards to an alternative program for school nurses?
Time.
Yes, Senator. Good day, Raquel Berry Benjamin, Commissioner Education. That is an ongoing conversation with the Department of Health Commissioner, Ms. Encarnacion, and her team. Yes, we've discussed, and yes, there is possibility for alternatives throughout our conversation so far.
Okay, thank you. And as you're aware, I messaged you, I messaged the Commissioner of Health, and both CEOs of the hospital so that we can have a conversation towards this end. Thank you, Mr. Chair, and at the appropriate time, I'll vote on this measure. Thank you.
Thank you very much, Senator Gittins.
Mr. Chair,
yes,
Mr. Chair, this is
Commissioner
Encarnacion, if I may.
Commissioner
One of the things that the senator asked about is whether or not we would be doing any outreach or promotion in terms of oral health. And I really wanted the general public to know that the campaign that we spoke about in February linked with the National Children's Oral Health Month. The campaign promoted the benefits of good oral health through ads, videos, outreach, and the creation of an oral health jingle. And the video was shared on social media platforms as well as YouTube, Facebook, and Instagram. So we have to begin somewhere. I think MCH is doing an incredible job at starting that educational outreach, and will continue to do so. Just wanted to put that down for the record. Thank you, sir.
Very well. Thank you again. It's back to basic. These are things that have been done in the past, and we just need to revisit those issues and get back to it because it's very important and it's safe in the long run in terms of the health care. You know, today we're having this whole discussion about fluoridization, and I can't help but to be concerned with the other components of oral health in terms of flossing. You know, being married to a dental hygienist, I hear and speak everything dental at times. You know, so I want to continue to implore that we have in this discussion that certainly, flossing, daily flossing, proper brushing, reduction of sugar intake, and certainly regular checkup is also critical. But I wanted to utilize my time to allow for the American Dental Association and to really speak to some of the resources that will be available to support this endeavor. I think it's critical that we're able to also get that out on the record before I go to the bill sponsor to close off this particular round. Dr. Grover?
Yes, thank you very much. So in discussions to implement the 5-year oral health plan, we of course have touched on many topics. And what the ADA offers, will continue to offer to our colleagues in the Virgin Islands, is the opportunity to bring together corporate support, educational support, and manpower to assist with this. The health centers do a phenomenal job, but for a project like this, as we have spoken, there would be a plan designed. We would work with the Virgin Islands Dental Association to offer timelines and work closely with the Department of Education in terms of the best time of the year to begin such a project. From corporate support, it would be donated product that our colleagues could use along with us. And again, the manpower piece of this would encompass some volunteers and people that we know would love to be part of this project. So we would walk closely with the health centers along this path, as well as the private practice colleagues who live there, practice there, and with an executive director with the insights of Dr. Taylor Griffith, we would work closely to design a plan that would encompass a variety of stakeholders and, again, offer that corporate support for product, but also engage the membership as well as some volunteers that would be credentialed through the health centers and have licensure within Virgin Islands to perform, get this project started, and then be able to report on results. We would welcome this opportunity to provide toothbrushes, education, and again, as Dr. Molinar suggested, start that baseline surveillance, data collection. So many steps and many hands would be part of this group. We're currently planning, and Dr. Taylor Griffith may want to comment on the February meeting that is being planned. That would be where we would be outlining some of the next steps of a plan that we would work over the next few months to develop and work closely with the Department of Education to have these additional conversations. And I would imagine that Dr. Griffith may want to add her comments as a clinician. Thank you.
Thank you, Dr. Griffith.
Yes, actually, I want to yield my time to my colleague in St. Croix, Dr. Manuel, because he actually had his hands up first, and then I will speak after him. Dr. Manuel, you can go first.
Dr. Manuel?
Thank you. I'm going to defer to my CEO.
Good day. Hi, this is actually Webster. I did raise my hand to share that the initiative that Commissioner Raquel Berry spoke about was actually Frederick State Healthcare. We do every year go into the schools and do outreach. Last year, due to COVID, we did it virtually. So it was Frederick State Healthcare she was talking about, but I think it speaks to some of the challenges we have had with communications with administration. It has been difficult to get into the schools and do these activities. Oftentimes it's that we know teachers and we just go directly to the teacher or the principal, but I did want to make that notation. I also did want to share or get to a concern raised by Attorney Bolt in regards to his concern about too much Medicaid money being spent on adults. It is a concern, as he shared, where in the mainland, on the United States mainland, there are other resources for the underserved population to get dental services, and I mean adults here in the VI, we don't have those options. We don't have like the supplemental dental plans and so forth that avail the underserved community on the mainland. So I'm concerned when we start to talk about too much money being spent for adults and there's no, any support or any resources or alternatives given to say, let's stop spending money on adults. I mean, these adults were children yesterday, and the children that we have today will be adults tomorrow, and they will continue to have some of the dental needs that they have. As many of the kids we get to early enough that we don't have to spend as much money on their dental care as we are spending on the adults. So it may look like on paper that all this money is being spent on adults for dental care, but if you get to the kids early enough, you don't have to spend that kind of money. But I just want to make sure that people are aware of that and people take that into consideration. Because if it is that, we have to change our Medicaid spending, then we have to come up with other alternatives or resources to support the adult population that does need dental care. So I was raising my hand to say that. And I also was concerned with our Commissioner of Human Services response, especially when you consider that Head Start falls under Human Services, foster care falls under Human Services, and the Medicaid program falls under Human Services. So I'm not sure she was totally aware of what today's hearing was about, but all of this just speaks to some of the collaboration that needs to continue around dental services for our community. Thank you.
Okay.
Thank you.
Thank you, Ms.
Thank you very much. And next we'll go to Dr. Griffith for her comments.
Yes, I was going to piggyback I was going to actually state some of the things that Ms. Sproul-Webster had mentioned in terms of some of the things that Frederiksted had started to do, and also some of the programs that East End has also done. As far as the private practitioners in our community, I know myself and at least 2 other practices, prior to COVID, we used to, with our staffs, go into certain schools and provide dental education, dental screenings for the children. But since COVID, obviously, we have not been able to do that. Speaking as far as what we have been doing in the community, I can speak for what Frederiksted has done because I work with Frederiksted, and I know for a fact they are out in the community beating the pavement and screening the children, because when the referrals come back to the clinic, I am the one who has to see the children. So I know that for a fact they are doing the work out there in terms of making sure that the word gets out, but the work cannot solely be on the one health center. We all need to put all our hands into it to make it happen. And I agree with a lot of what some of the senators said as far as what was done in the past and bringing back dental care into the fray and the fold of making it part of what we do in the public health system. As far as what the Dental Association is going to be doing, we've already started working on putting a CE program together for our practitioners. And part of what we're also going to do is reinvigorate the organization to get more of our practitioners, beside myself and 2 others, to be involved in the initiatives that we're putting forth now.
Senator Francis.
Thank you very much, Commissioner Rockleberry. Benjamin, go ahead.
Thank you so much. And before you close, I want to personally thank Frederiksted Healthcare for all that they do. And I just wanted to clarify, and Ms. Sonia Taylor-Griffith, hi, it's good to see you, for all that they do for our children. Very quickly, Senator, I just wanted to clarify. So we're talking 2 things. And in my remarks, I did not have the schools in which Frederiksted Healthcare had served. The partnership that I was referring to was with Colgate Corporation. So it's not to say that Frederiksted did not provide services. I share the schools that benefited from the Colgate Corporation. So it's 2 different types of services. I just wanted to clarify that. Thank you.
Very well, thank you. At this time, we'll go to a point of inquiry by Senator Gittins, and then we'll have the bill sponsor, Senator Blyden, close off this round.
Thank you, Mr. Chair. It's a point of information, actually an observation. I couldn't help but to realize the absence of a crucial entity, being that of the Department of Human Services, from today's discussion, when they have a critical component there of our Head Starts. Again, when we're having these conversations, we have division heads and whatnot if the head of the agency cannot be here. And I can't, I don't know how else to continue to say that we have to look at the importance of these things and ensure that if the head of the agency cannot be here, those individuals who are directly responsible for these functions within the department should be a part of these discussions. Again, the Department of Human Services, somebody for the Head Start program should have been here with regards to this discussion today. So I'm asking us to please ensure that the agency heads understand the importance of these discussions. Thank you.
Thank you very much, Senator Gittins. Your comment is so noted and extremely important that we do have assistant commissioners and directors and those others that could certainly be able to second seat the unavailability of commissioners. But nonetheless, we'll move forward. I think today's discussion has been a very good discussion. We'll go to Senator Blyden, one of the bill sponsor, to close off this particular session. Senator Blyden. Before we go to Senator Blyden, point of inquiry real quick, Senator Soro.
Thank you, Mr. Chair, for your indulgence. Commissioner Barry Benjamin, briefly, in our tours of the school and being a product of the public education system, we often walk by the bubbler because of the condition of the bubbler. It's really not sanitized and clean. COVID wouldn't last forever. Have you done an assessment of the bubblers? Replacement of the bubblers, what's not? Because I know going through public education, I've never drunk from the bubbler just because of how it looked. And I go back and you know that I coach CAHS on the bubbler right outside from the courts, the gym. The students bypass and we always provide them water in practice. So have you done an assessment of what it'll cost to repair, sanitize, fix the bubblers?
Thank you, Senator. Our bubblers are being replaced with water filling stations in our schools.
Thank you. Thank you so much for that.
Thank you. Thank you. Senator Blyden, you recognize. Please recognize Senator Blyden. 5 minutes.
Thank you. Thank you, Mr. Chair. And I am happy to have the discussion this morning. I know my colleagues brought some concerns forward. I would like to address some of them with my time. I know one of my colleagues spoke to creating legislation, but I must remind them that it's already codified. We're just amending the law. So we're not creating new legislation. Also, some of my colleagues spoke to the cost, and in our research, it's going to cost at least $3 per person. And we know that for every dollar spent in prevention, it saves us 10 times more with treatment costs down the road. And of course, when I spoke to the $45 billion lost every year in terms of productivity when it comes to this dreadful disease. And also, I must stress that ADA has pledged to provide the materials and personnel and also volunteers, etc., moving forward. So they play a critical role in terms of assuring that we can move forward with this most important piece of legislation. But I want to go back to WAPA's testimony and my disappointment with that testimony, because we met with all of the stakeholders, to include WAPA. And based on WAPA's legal counsel statement, and they seem to be saying that this section was repealed by implication when the Safe Water Drinking Act statutes were passed, giving authority over drinking water to DPNR. But I don't believe that analysis is correct, because the rules of statutory construction tells us that when there is an apparent conflict between two statutes, the latter overrules the former, and the specific overrules the general. So because Chapter 75 of Title 19 is specifically related to fluorine content, it is not overruled by subsequent statutes giving DPNR authority to regulate safe drinking water. As we know, Safe drinking water and fluorinated water are two different things. Water can be safe without being fluorinated, and it can be fluorinated without being safe. In other standards for clean water aren't adhered to, which means that based on my colleague's statement earlier, we know that it's WAPA's responsibility, their responsibility. So I did not understand that testimony, and I'm most disappointed in that. I must say, though, that this legislation is a landmark piece of legislation for future generations, that I stated before, and I honestly want to thank all of the parties that here today that testified, because we met and they get it, they understand, and we all want the best for our young people and our future generations. So I want to thank them for their responses. I want to thank my co-sponsor, Senator Francis, and his team, and of course I want to thank my team for their due diligence also. Let me ask, though, let me use up all of my time since I'm the sponsor. And can I have Dr. Sonia Griffith Taylor speak some more in respect to what she has seen with most of our youngsters and how this piece of legislation can assist in correcting that wrong moving forward?
Okay, to answer your question, Senator, I've seen it in several ways. First of all, our children are brought, well, to me by their parents. And for not all children have parents that may be as fully engaged as all of us are to realize the importance of good dental health care. So for those children whose parents may not be fully educated on it or may not have access or the resources, having a school-based fluoride rinse system will help fill that gap. So that's the first thing. Second of all, having all the players who are involved in public health being a part of this, namely Frederickstead Health Center and St. Thomas Eastern Clinic, working together with the Department of Health and the Department of Education, and those of us who are in private practice, to make sure that we meet the needs of all our children, not just some of our children. I also wanted to say that a lot of this work we have been trying to do and we have been doing, but we still have more to do. And working with the American Dental Association with their resources will definitely help us in that vein.
Thank you, and very well. And Commissioner Hussein Encarnacion, can you speak briefly to what you spoke of in your testimony with your department and the PNR in terms of sharing the responsibility when it comes to regulation and or implementation?
Okay, and in accordance to DPNR and reference to the code that was spoken of, DPNR actually holds the responsibility for evaluating or testing municipal water. We do in terms of environmental health for non-municipal water. So in reference to that's how the code stands right now, in reference to what decisions are made and if they're merged. But that is really and truly where the code is right now. So we will take the responsibility of us, but in collaboration with DPNR, Commissioner Ria and I work collaboratively together, and we'll continue to do so. If the decision is made for one to take responsibility over the next, I think health will always remain the responsible party for pulling the data and making assessment and giving recommendations and ensuring that those recommendations are instituted in terms of preventive care.
Okay, thank you so much. And again, in closing, I want to thank you for your responses. And of course, I do have an amendment that will address some of the concerns moving forward. And again, I ask my colleagues for the support. Thank you so much, Mr. Chair, for the time.
Thank you very much, Senator Blyden, and thank you for your leadership in terms of, again, this piece of legislation and your stakeholder engagement in this, even on weekends. But I think it was important for us to bring all of these stakeholders together to discuss this very important measure. And again, I believe that there was a lot of dialogue input that allow for the crafting of this legislation. Of course, no bill is perfect, and there'll be some additional tweaking that may be required, but we're in a road to success here. At this time, what I'll do is allow for each of the testifiers to give a 30-second wrap up, and then we'll go to a vote on this measure. So we'll start what we began earlier with Commissioner Encarnacion. 30 seconds.
Thank you, sir. First, I'd like to say the Department of Health will continue the cause of implementing preventive health measures throughout the Virgin Islands. And to link to what Dr. Griffith actually indicated, most important is actually to continue the collaborative effort that we began this weekend for dental prevention and care throughout the community. One person can't do it. It has to be all of us getting together, supporting each other, and ensuring that it's done successfully. Thank you, sir.
Thank you very much, Commissioner Encarnacion. Next, we go to Commissioner Barry Benjamin.
Thank you so much, everyone, for this opportunity. We are definitely on the right path. This is something the Department of Education wholeheartedly supports, as it is supporting our efforts to support the whole child, develop the whole child at the VI Department of Education. I thank all of the individuals here who have worked with our students, supported our students in the past, and will continue to do so in the future. Thank you for your collaborative efforts. And I will be reaching out to some of you so that we can engage in discussion as we continue these efforts. Thank you.
Thank you, Commissioner. Next, we'll go to Interim ED, Mr. Hodge.
I want to thank the Senate committee for the opportunity to give testimony and to answer questions on this matter. And WAPA, remains available and willing to continue to distribute potable water to the community and meet all the requirements that set forth by law. Thank you.
Thank you, ED Hodge. Next, we'll go to Dr. Molinar.
Thank you, Mr. Chairman. I am just thrilled to witness the resurgence of an interest in public health programs. I served as dental director, territorial position, from the early 70s into the late 90s, and as deputy commissioner for public health services for another 3 years. During our heyday, we had 7 dental clinics throughout the territory, and we had significant assistance from a great public health nursing program, immunization program, and the like. And I'm just glad to see that there will be a continued interest in this, and I will be standing on the side to watch. I retired 3 times already. Thank you.
Thank you, Dr. Molinar. You're going to be around for a long time. We ain't worrying. Thank you for all that you do. Next, we'll go to Director Dr. Grover.
Well, I want to thank you again for the opportunity to offer testimony. We look forward to walking down this path to improve oral health for the children of USVI, for everyone in USVI, quite honestly. And a special thank you and recognition to Dr. Molinar and Dr. Manuel for what they do every day. Unsung heroes for sure. And we look forward to the brilliant leadership of Dr. Sonia Taylor Griffith as we design and implement this project going forward. Thank you.
Thank you. And then we'll go to Zokai.
Yes, hello. Thank you so much for hearing us all today and getting into some really important discussion about action. I want to thank everyone who is here today for the common ground of preventing disease in children and giving the children the best opportunity for continued health, not just oral health, but total health. So that will take all of us working together and creating a plan that isn't just about fluoride in the water, but about all the ways that the evidence has shown can prevent disease. So I look forward to your continued leadership, and the ADA is always here to offer the support to move it forward. Thank you all so much.
Thank you, Dr. Ms. Zokai. And next we'll go to Dr. Taylor Griffith.
Thank you, Senator. I just want to again express my gratitude to yourself and Senator Blyden for bringing this bill forward because it's brought awareness to something that's near and dear to my heart, dental care, and specifically pediatric dental care. Also, added to all the many hats that I wear, taking on the role of being the newest executive director of our Virgin Islands Dental Association, I'm really pleased that I'm going to be a part of a resurgence of public dental care in our community. And I really want to acknowledge my colleagues at Frederickstead and East End Clinic because I know you guys work very hard. I work with you and for you, and I support you, and I will continue to support all of us as we walk down this road to make dental care be at the forefront as it should be. Thank you.
Thank you very much, Dr. Griffith. Attorney Bolt.
The legislative process is a process where we take and we receive public input and we improve a bill. And I believe that Senator Blyden will be offering an amendment, which I believe everyone supports, and I think that will improve the bill. But I think also that if we're going to really do something for oral health care in the territory, if we really care about the health of our youth, I think it's very important that we restore the position of territorial dental director in the Department of Health. And I think that that would go a long way at implementing a lot of the plans that we have talked about, including the 2019 Oral Health Care Strategic Plan that was developed in coordination with the American Dental Association and the Virgin Islands Dental Association. So hopefully we can, as this bill proceeds through the process, be able to add that addition of the territorial dental director.
Thank you, Attorney Bolt. Dr. Manuel?
Thank you for this opportunity. Senator, I'd like to actually thank you for starting off the session too by just reminding everyone to get vaccinated. I do want to remind us that we are in a pandemic, and more than ever, oral health is real important because what's happening right now, we're finding our patients are relapsing because of the lack of care. So even more, it is so important that we do pursue these type of programs for children. But it's more important that we all stay safe in this vaccination, in this process. So again, vaccination is important. One of the things, of course, in oral hygiene is that dentists and hygienists, we're probably at the 95th percentile exposure rate. And we have done, I think, a great job at the health center to keep our patients safe, to keep our sites from closing, so to keep functioning in the pandemic. So I want to thank my colleagues, East End, Dr. Sonia Griffith, who continue to provide service in the pandemic, especially for the children. So I'm really grateful for my colleagues and all that we do. I want to let you guys know that this is practical. Don't see, I know we have the issues with WAPR, but as far as the school base, this is something that we can do tomorrow. Fluoride is something children can apply right now. They can benefit from it right now as we speak. Not just a fluoride application, the sealant. So a lot of these things that we're doing are very practical, they're hands-on, and not only can be done in a dental setting, they can be done in a medical setting also. We have medical providers who are providing these services, so providing fluoride. So again, it's an all hands on deck approach. We need everybody involved. We need a communication to get better. And we're going back again to what we said in our testimony. We need mandates. There should be mandates for all examinations and for physical examination on our children in the school system. This will help all our parents accountable also, because like Sonia said, it's disheartening when we see children that we've treated. Dr. Sonia Griffith and I, we looked at x-rays just on Monday, where we saw a patient that relapsed, that we put thousands of dollars in on this child, and now this child is relapsing, and it's again because of poor oral habits. So again, we have to plug into a community, make this a serious issue. We have to address the eating habits of our community. We need to go back to nutrition and diet. It has to be part of education. We cannot solve this if we're not doing those things from an education standpoint. So the education component is as big as prevention. So I really appreciate we're going in this direction. I hope we can continue to communicate with each other, because I think that's the key. We need to all have the same workflow pattern in progress, so that at least we're making the steps in the right direction. Again, thank you so much for the Health Center and for the Board of Directors, our patients, And our staff, we appreciate the opportunity to contribute to this discussion.
Thank you very much, Dr. Manuel. Thank you for your passion. I certainly appreciate it. And I want to thank all of the stakeholders for your input today. We do have some of you that will be on a second bill, but at this time, again, you could sign off if you're not on the second bill. We'll be taking a 2-minute recess, and when we come back, we'll take a vote on this, and simultaneously, we'll go right into the next bill. Committee of Health, Hospital, and Human Services stand in recess for 2 minutes. We're out of recess. At this time, do I hear an amendment? Senator Blyden, you're recognized for your amendment.
Thank you, Mr. Chair. I move amendment number 34-263 to bill number 34-0051. Bill number 34-0051 is amended in the following instances. 1. In section 1, by striking all of the language after striking and inserting in its place the following. All language after the phrase fluoride content of and inserting in its place 0.7 of 1 milligram per liter beginning in 2025 and every 3 years thereafter. The fluoride content shall be adjusted in accordance with any updates guidelines promulgated by the U.S. Department of Health and Human Services. 2. By adding 3 appropriately numbered sections that reads as follows. Section blank. Title 17 Virgin Islands Code, Chapter 10, Section 3 is amended in subsection C in the following instances. A. By inserting in the first sentence, and dental after the health, and B. By inserting after the penultimate sentence, the following such services shall include dental preventative service, including but not limited to a school-based fluoride rinse program that shall be implemented over a 3-year period commencing in the year 2022-23 academic year. The program shall be administered among incoming kindergarten students in the first year of operation. Shall be expanded to students in K3 in the second year and shall be administered to all students in grade K6 thereafter. The Department of Education and the Department of Health shall solicit the received federal and private sector grants and other assistance to facilitate the development of the school-based fluoride rinse program. All such funds shall be covered into the school-based dental prevention and treatment fund established by Title 33, Chapter 3, Section 3100 CC of this code. The Commissioner of Health and the Commissioner of the Education shall jointly submit an annual report, submitted no later than July 30th of each year on the school health program, which shall detail information including but not limited to 1. The number of students by school that have completed health and dental screening. 2. The number of children by school that have been vaccinated in accordance with the requirements promulgated by the Commission of Health. 3. The prevalence of preventable health conditions in school-aged children. 4. The services provided to screened students. And 5. Recommendations for changes and improvements to school health program. Section blank, Title 27, Virgin Islands Code, Chapter 1, Subchapter 3, Section Technical Amendment, remove 57, insert 67, is amended by adding paragraph 10.
Senator Viale, you're recognized for your motion.
Thank you, Mr. Chair. I move to waive the reading. I so move.
Motion by Senator Viale to waive the reading has been made and seconded by Senator Carrion. Hearing no objection, so ordered.
So move. I so move.
So move by Senator Blyden and seconded by Senator Carrion. Hearing no objection, so ordered.
Motion.
Motion, Senator Blyden, you recognize.
Thank you, Mr. Chair. I move Bill number 34-0051 as amended, an act amending Title 19 Virgin Islands Code, Chapter 75, Section 4201, relating to the fluoridation of water to lower the required minimum amount of fluoride in fresh water distributed for public consumption or for consumption in any school in the Virgin Islands. I so move.
Motion properly made by Senator Blyden, seconded by Senator Carrion. Hearing, Madam Clerk, roll call.
Senator Blyden? Senator Blyden, yay. Senator Carrion? Senator Carrion, yay. Senator Gittins? Senator Gittins? Yay. Senator Francis Heiliger?
Yes.
Senator Francis Heiliger? Yay. Senator Soro? Senator Soro? Yay. Senator Violet? Senator Violet? Yay. Senator Francis Jr.?
Yay.
Senator Francis Jr.? Yay. Mr. Chairman, 7 yeas.
Thank you very much, Madam Clerk. Bill number 34-0051, an act amending Title 19 Virgin Islands Code, Chapter 75, Section 4201, relating to the fluoridization of water to lower the required minimum amount of fluoride in fresh water distributed for public consumption or for consumption in any schools in the Virgin Islands, as amended, have been approved by the Committee of Health, Hospital, and Human Services. I will be sent to the Rules Committee for further consideration. Madam Clerk, please call up the next item on today's agenda.
Bill number 34-0040, an act amending Title 27, Chapter 1 of the Virgin Islands Code by adding a new subchapter 5A, establishing the Nurse Licensure Compact to create a multi-state nursing license, sponsored by Senator Kurt A. Violet. Invited testifiers: Rebecca Fash, Director, State Advocacy and Legislative Affairs, National Council of State Boards of Nursing; Tanisha Penn, Chairperson, Virgin Islands Board of Nurse Licensure; the Honorable Justa E. Encarnacion, Commissioner, Virgin Islands Department of Health; Carmen Vanterpool Romney, Territorial Executive Director, Virgin Islands Board of Nurse Licensure; Dr. Louis O. Amaro, Interim Chief Executive Officer, Schneider Regional Medical Center; Ms. Daima Williams, Interim Chief Executive Officer, Governor Wang F. Louis Hospital and Medical Center.
Very well, thank you very much, Madam Clerk. Let's go to the testifiers just to do a quick device check, and then we'll go to the bill sponsor to present Bill 34-0040. Director Fosh, attorney. You're on mute. Very well. We can hear you now. Go ahead.
Oh, okay. Good morning.
Good afternoon. Here.
Oh, good afternoon,
we
sir.
can hear you. No problem. Nurse Penn, Chairperson of the Virgin Islands Board of Nurse Licensure.
Good afternoon, Senator.
Good afternoon. Commissioner Encarnacion.
Good afternoon, Senator.
Good afternoon. Executive Director, Ms. Romney.
Good afternoon, Senator.
Good afternoon. Dr. Amaro.
Good afternoon, Senator.
Good afternoon, Doc. And Ms. Daima Williams, Interim Chief Executive Officer, Juan Francisco Louis Hospital.
Good afternoon, Senator Francis.
Good afternoon. At this time, we'll go to the bill sponsor. Senator Violet, you recognized for presentation on Bill 34-0040.
Thank you, Mr. Chair. We had a discussion in reference to this bill, I think a couple months ago, in reference to passage of the Nurse Licensure Compact that would allow nurses in the Virgin Islands to have a reciprocity agreement with some 38 states and one territory. And that literally means that licensure of individuals on those 38 states who want to relocate to the Virgin Islands would become a way simpler process. And it would also reverse that nurses in the Virgin Islands that become a part of the compact will also be able to move to one of those states in which we have a reciprocity agreement and be able to practice. There is some fear among some individuals, some trepidation in reference to this particular measure. But this measure is no different to what is currently being utilized in more than 70% of state and territories across the nation. We must look at what is going on in healthcare right now, and there's a crisis in healthcare when it comes to nursing. There's a very, very, very serious crisis as a direct result of us fighting this Delta variant. And the Virgin Islands is a part of that crisis where we do not have sufficient RNs or boots on the ground to be able to make sure that our hospitals have 24/7 service. And we have heard the complaints back and forth, some from our local nurses in reference to Pafford being here. But the truth of the matter is that all across the nation, they're hiring these firms to supplement hospitals because of lack of adequate staffing. All across the nation. I have seen within the last couple of weeks, I just saw one yesterday in Texas, $20,000 for nurses to come to Texas, and they had in a requirement that they cannot, $20,000 a month, and the requirement that they had in is that they could not be a nurse that is presently working in any Texas hospital or a resident of Texas. So it clearly showed that they were trying to bring in a population that don't exist in Texas because there's a need to supplement. I read a post last night from one of our nurses in ICU, an excellent nurse, Anne St. Croix, a former student, matter of fact, and she related that she had just completed a 17-hour shift, and she was literally totally burnt. And in it, she said, there is a lot of complaint about travelers, but they're needed for us to keep these units going. And I think at the end of the day, we need to put everything in perspective. And this reciprocity agreement will definitely allow the process of us being able to attract healthcare professionals to the Virgin Islands a lot easier. And it will also literally increase opportunities for our individuals who are local nurses here who might want to be a part of the multi-state licensure and be able to relocate. And some people say, well, why? But, you know, we have had nurses in the past that leave the Virgin Islands and went to the mainland, and we have individuals on the mainland that come here. So I think we need to open our minds, and we need to look at every single opportunity that we have to increase health care in the Virgin Islands. And some of the decisions are not going to be comfortable, but I think there are decisions that we don't have any choice but to make if we are going to be able to take care of our population. The current situation at these hospitals are dire. Beds are filled, there's limited rooms, elective surgeries canceled on St. Croix, et cetera, et cetera. In order to be eligible for multi-state license, those individuals must pass NCLEX. They must have no active discipline on a license. They must submit to state or federal fingerprint-based criminal background check. And in this particular bill, we added in a section where whoever utilizes a nurse from the Nurse Licensure Compact, they must report to our local nursing board within a set period of time and must notify them as to those individuals who are here. At the same level, those individuals who are licensed in the Virgin Islands by our nursing board, those other jurisdictions would have to respect our nurse licensure capabilities in the Virgin Islands, like we would have to respect them. So I'm asking for the support, you know, for this particular measure, because I think overall it's going to help us. I thank you so much, Mr. Chair.
Thank you very much for presentation on Bill 34-0040. Just as a measure of housekeeping, this bill was originally heard in the Committee of Health, Hospital, and Human Services and voted out to the Committee of Rules and Judiciary on April the 13th, 2021. It was heard in the Committee of Rules and Judiciary on April the 22nd and voted out onto the floor. However, during session, it was determined that we wanted to allow for some additional testimony, and it was sent back on May 4th of 2021 back to the Committee of Health, Hospital, and Human Services, where we continue to do stakeholder engagement and have a discussion regarding that. All along, the crisis continued to manifest. So at this point, we're back. This bill is back before us, Bill 34-0040, and we'll be hearing from these stakeholders again today. I want to welcome Senator Carla Joseph. Thank you for coming. And at this time, we'll go to the testifiers for presentation or to hear their testimony on this particular measure. We'll start off with the Wang Louis Hospital. Daima Williams, Interim Executive Director, you recognize for your testimony.
Thank you so much, sir. I'm hearing a bit of an echo. Okay, that's better. Good morning, Honorable Chairman Novell E. Francis Jr., Chairman of the Committee of Health, Hospitals, and Human Services, honorable committee members, other senators of the 34th Legislature of the U.S. Virgin Islands present, and the listening and viewing audience. My name is Daima Williams, and I am the Interim Chief Executive Officer of the Governor Wang F. Louis Hospital and Medical Center. Our understanding is that the proposed legislation, Bill number 34-0040, amends Title 27, Chapter 1 of the Virgin Islands Code by adding a new subchapter which establishes the Nurse Licensure Compact to create a multi-state nursing license. Since our last testimony in April, legislation for the Nurse Licensure Compact has been passed in an additional 4 states. The new total for states that have adopted NLC legislation to 38 U.S. states. For JFL, this is equivalent to 38 opportunities for robust recruitment efforts in states that are members of the NLC. We believe that instituting the Nurse Licensure Compact will result in an efficient, streamlined licensing process. This will ultimately result in a shorter recruitment process and allow JFL to fill positions quickly. This is especially critical during our current surge and the need to provide continuous care for every JFL patient. Without question, we are in favor of this bill as the ultimate result would be improved access to care. The shortage of nurses in the Virgin Islands is not a challenge that is limited to JFL or the territory. It is estimated that by the year 2025, there will be a nursing shortage of 500,000 nurses in the United States alone. Below, we provide a visual representation of the factors driving the nursing shortage. Please reference the infographic included. JFL is in support of this bill, and we consider the NLC as the first step in conquering the nationwide nursing shortage and access to the critical care needs that our nurses meet every day as we work to not only meet the current needs of our community, but project our needs for the new JFL hospital of the future. Suggested amendments. We have reviewed the recent amendment to the bill, which mandated that the hospital inform the Board of Nurse Licensure of nurses present or nurses who present with a multi-state license and submit further requests for amendments to meet the needs of JFL and the greater territory. 1, for the future, nurse retention must be addressed. In addition to recruiting, this bill may also result in nurses choosing to leave the Virgin Islands. As such, retention of our hardworking nurses that are already here must be addressed. I cannot say enough about the dedicated group of nurses that ensure quality care for JFL's patients every day. Every gunshot wound victim, every trauma victim, every critical COVID patient, and every abused child on the island of St. Croix comes to GFL. While recruitment is important, please do not forget our local experienced dedicated team members who are culturally competent and have already vested in our community. We ask for this body's consideration of financial incentives for retention of our current nurses on staff, including competitive salaries for all nursing disciplines, a viable employee benefits package, and an attractive retirement package. Lastly, we ask this honorable body to take another look at Bill number 33-0053, a bill which offered cash incentive payments, relocation payments, and delayed retirement bonuses for nurses, teachers, correction officers, and police officers. For the future, we would like to see these benefits provided for employees that will relocate here to the Virgin Islands and spend these cash incentive payments here. In closing, GFL thanks this body for taking a special interest in the recruitment of nurses to the territory at this critical time. Thank you for inviting us to testify regarding this bill, which addresses the nursing shortage and the proposed statutory intervention to address this shortage. We thank our current nursing staff for their dedicated service to GFL, our patients, and our community as a whole. I want to thank the Honorable Senator Novell E. Francis, Jr., Chairman of the Committee on Health, Hospitals, and Human Services, and the members of the committee for the opportunity to provide this testimony here today. I would also like to thank the bill sponsor, Senator Kurt Vialet, for his vision and heart for healthcare. I will be happy to answer any questions you may have about this bill. Thank you.
Thank you very much, Interim CEO Adima Williams. I hear you loud and clear. I appreciate your testimony and your comments. At this time, we'll go to Dr. Amaro. You're recognized for your testimony.
Good afternoon, Honorable Senator Novell E. Francis, Jr., Chairman of the Committee on Health, Hospitals, and Human Services, other members of the 34th Legislature present, fellow testifiers, members of the press, the viewing and listening audience. I am Dr. Luis O. Amaro, Interim Chief Executive Officer of Schneider Regional Medical Center. I'm accompanied today by Ms. Walda Mason, Executive Director of Human Resources. Thank you for allowing us the opportunity to provide testimony on the proposed legislation, Bill number 34-0040, an act amending Title 27, Chapter 1 of the Virgin Islands Code by adding a new subchapter 5A establishing the Nurse Licensure Compact to create a multi-state nursing license. As stated in our previous testimony, SRMC supports Bill number 34-0040. Specifically, it's aimed to significantly improve our hospitals' access to a larger pool of qualified licensed registered nurses and other clinical professionals. Now, more than ever before, our hospitals are in critical need of licensed registered nurses and other clinical professionals to support the surge of patients that are COVID positive in our territory. Despite our robust recruitment and retention efforts, the shortage of registered nurses, clinical and allied health professionals persists in the territory. And this shortage has only intensified with the COVID pandemic. In fact, without the support of contract staff such as PAFORD, our hospital would not have been able to sustain its current level of services. Allowing the Virgin Islands to become a part of the Nurse Licensure Compact will create new avenues for our hospitals to engage, recruit, and retain critical personnel. The NLC gives clinical professionals the option and convenience of choosing multiple locations to work from, including the Virgin Islands. We acknowledge that becoming a part of NLC has inherent risks, including the potential to lose some of our local nurses to other states available in the compact. We also understand the concerns regarding potential deficiencies in background checks and the lack of enforcement to ensure nurses in the NLC meet local licensure requirements. There are also some financial implications which the Virgin Islands Board of Nursing Licensure will address. According to the National Council of State Boards of Nursing, the Nurse Licensure Compact allows a nurse whose primary state of residence is in an NLC state to hold one multi-state license. That nurse is also given the authority to use a multi-state license to practice in person or via telehealth in their home state and any of the 33 other NLC states, giving nurses greater mobility and access to more healthcare institutions. If we're given access to the NLC, it will significantly reduce our wait time to secure licensed nurses to practice in the territory. Currently, the average wait time to process a temporary license for a nurse through the Virgin Islands Board of Nurse Licensure can take up to 2 weeks. The process for permanent nurses is even longer. The newly proposed amendment to this bill that requires all hospitals and healthcare facilities in the Virgin Islands that employs a nurse under Title 27, Chapter 1, Subchapter 5A, to report the name of the person employed and a copy of the multi-state license to the Board of Nurse Licensure within 60 days of hire is a step in the right direction. We think this amendment strengthens this bill and increases compliance with local regulations, which move up closer to a product that is beneficial to the entire territory. An additional consideration is to provide an opt-out measure by which a nurse can opt out and remain solely licensed in the Virgin Islands, which is a less expensive alternative for the applicant that also helps us to maintain some level of security with retaining our nursing workforce. To that end, SRMC supports the advancement of this bill with the recommended safeguards that ensure compliance with local licensure mandates and background checks. Honorable Chairman Francis and members of the Committee on Health, Hospitals, and Human Services, thank you again for allowing us the opportunity to give testimony to this proposed legislation. We also want to thank the bill sponsor, Senator Kurt Viale, for the proposed legislation. We are prepared to take your questions.
Thank you very much, Dr. Amaro. And next we'll go to Commissioner Encarnacion. No disrespect, Commissioner, we wanted to give your vocal cords a little bit of rest. You're recognized for your testimony at this time.
No disrespect taken at all. Thank you, Senator. Good day, Honorable Senator Noel E. Francis, Jr., Chair of the Committee on Health, Hospital, and Human Services, Honorable Senator Marvin A. Blyden, Vice Chair, committee members, and all other members of the 34th Legislature of the Virgin Islands of the United States, and the listener and viewing audience. I am Justa E. Encarnacion, Commissioner of the Virgin Islands Department of Health. I have here with me today Dr. Nicole Cragwell-Sims, Assistant Commissioner, and Hadia Charles is not able to be here with us today due to illness. Thank you for the opportunity to testify on BR 21-0344, an act amending Title 27, Chapter 1 of the Virgin Islands Code by adding a new subchapter establishing a nurse licensure compact to create a multi-state nursing license. I want to once again thank Senator Viale for presenting a bill that will change the manner in which we hire nurses in the Virgin Islands and provide options and access to those that are in high demand. The Nurse Licensure Compact aims to increase access to care while maintaining public protection. Under the Nurse Practice License Compact, nurses can practice in other nurse licensure compact states and or territories without having to obtain additional licenses. The general purpose of this compact is to facilitate the territory's responsibility to protect the health and safety of the public, which we need right now, ensure and encourage the cooperation of the nurse licensure compact states in the areas of nurse licensure and regulation, facilitate the exchange of information between nurse licensure compact states in the areas of nurse regulation, investigation, and adverse actions, promote compliance with the laws and laws governing the practice of nursing, decrease redundancies in the consideration of issuance of nurse licenses, and provide opportunities for reinstated practice for nurses who might uniform license requirements. The Nurse Licensure Compact will allow registered nurses and licensed practical vocational nurses to have one multi-state license with the ability to practice in their home, territory, state, and other nurse licensure compact states. Under the Nurse Licensure Compact, there will be cooperation and sharing of information regarding licensure, regulations, investigations, and adverse actions between these states. This is a model act that aims to standardize nurse licensure throughout the nation. It will improve retention and recruitment by offering community. The Department of Health is satisfied with the definition of Article 2, along with the clearly identified proposed structure and operation of the compact. The enactment of the bill will call for modernization of the current board structure that may require the need for increased finances and other resources. As indicated in our previous testimony in the support of the bill, the following is necessary prior to the bill being fully enacted in order to secure success of the process. Those requirements are the hiring of additional personnel, of course, IT upgrade, securing of funds for purchasing of equipment and maintenance agreements and reestablishment of operations. I also support the amendment as described in Section 1 of Bill number 34-0040 with the addition of the following paragraph to Section 116. Any hospital, federally qualified health center, urgent care facility, surgical centers, or any other healthcare entity that employs a nurse under Title 27, Chapter 1, Subchapter VA must report the name of the person employed and a copy of the multi-state license to the Board of Nurse Licensure within 60 days of hire. This amendment would allow for the needed regulation, tracking of licensure, and other demographics to be collected. In conclusion, Senator Francis, the Virgin Islands Department of Health, supports this measure and remains committed to reducing health risks, increasing access to quality health care, and enforcing health standards. Senator Francis, thank you for allowing us the opportunity to collaborate with you, members of the Committee on Health, Hospital, and Human Services, and other members of the 34th Legislature who came together to discuss a bill that would impact the territory's health care options and in turn increase access to care. Senators, this concludes our testimony. I welcome the opportunity to respond to questions you may have. Thank you, Senator Francis.
Thank you very much, Commissioner Encarnacion, for your testimony. Next, we'll go to Chairperson of the Virgin Islands Board of Nurse Licensure, Nurse Penn. You're recognized for your testimony.
Good afternoon, Senator Norbert Francis Jr., Chairman, Committee on Hospital, Health, and Human Services, and other members of the committee, other testifiers, and members of the community. With me, I am here with the Territorial Executive Director, Mrs. Carmen Vanderpool Romney, and Mrs. Arnell Commission, Treasurer. Thank you for allowing us this opportunity to testify on Senate Bill number 34-0040.
Nurse Penn, I'm sorry. Nurse Penn, you sound a little bit muffled. Can you get closer to the device or remove your mask, if possible?
I'm going to come a little closer.
Okay, thank you.
You can hear me any better? Is that better?
Yes, it is. Thank you.
Okay. Where was I? Thank you again, Committee of Health, Hospital, and Human Services. Stated as before, members here with me, Territorial Executive Director, Ms. Carmen Vanderpool, and Ms. Arnell Commission, Treasurer. We're here, and thanking you for the opportunity to testify on the Senate Bill number 34-0040, an act amending Title 27, Chapter 1 of the Virgin Islands Code by adding a subchapter of the Nurse Licensure Compact to create a multi-state licenses. The Nurse Licensure Compact allows registered nurses and LPNs, licensed practical nurses, to hold one multi-state license in their primary state of residence, which would be their home state. And this will allow them the ability to practice in person or telephonically in other compact states, which are considered remote states, while subject to each state's practices and their discipline laws. Advanced practice registered nurse at this time is not included in the Nurse Licensure Compact. We would like to thank Senator VLA for the opportunity to collaborate with our nurses and allow the members of the team to understand what Nurse Licensure Compact is. During this time, we were able to analyze the benefits and risks associated with joining the NLC. With the help of the National Council of State Boards of Nursing, we were able to survey registered nurses at the Virgin Islands Board of Nurse Licensure. Although the amount returned was small compared to our total nurses of those surveyed, 97% of our members were in favor of the Nurse Compact. It is with these results that the board moved to join and support the NLC. In support of the bill, the VIBNL would simplify what Nurse Compact would not mean to the Virgin Islands. However, Nurse Licensure Compact is not about the process, but having more availability of nurses from a larger pool. Nurses will still be processed and guided by the National Council for All Nurses. The VIBNL will not be removed or replaced by the NLC. We are and will remain a member of the National Council of State Boards of Nursing. On average, an applicant can receive their license in less than 10 days once all required documents are submitted and there is no discipline. Again, I say, licenses in less than 10 days can be received once all required documents are submitted and there is no discipline. In reviewing all the states for the turnaround time with permanent licensure, the process averaged between 2 to 6 weeks. Therefore, VIBNL time frame is on par with other jurisdictions, although we are not at total staffing capacity and our process is presently done manually. We expected to be online by this present renewal period. However, due to circumstances beyond our control, nurses will not be able to apply online this renewal year. Hence, moving forward next year, we will be able to do that. Getting nurses into the territory is crucial, especially with the onset of COVID-19, and the board is fully sensitive to our challenges. However, we will not overlook our processes or lower our standards for ensuring that we have competent world-class nurses at the bedside of our loved ones in the territory. We have been told that nurses are needed to save lives. However, at worst or at what cost? Should we not ensure adequate vetting and proper presentation of documents to the board by each nurse? Are we wrong for seeking the best for our territory? We have been graced by caring, competent nurses here in our islands, and maintaining the standards is prominent to positive patient outcomes. Our nurses worked through the first phase of the pandemic and cared when there was minimum help. I would like to thank all the nurses of the Virgin Islands, St. Thomas and John, St. Croix, Water Island as well, for their resilience in this time of COVID-19. Therefore, those joining us will come with no fewer expectations to care for our people. So you will not be served with less people of the Virgin Islands with licensure to the Compact or the Virgin Islands Board of Nurse Licensure. We at the board were nominated to protect your safety. We understand the pandemic, but mindfully act accordingly and let us not endanger the health of our people. Who stand before you are passionate about our obligations to protect the people's health. Becoming part of Compact is no way a quick fix to the nursing shortage in the Virgin Islands. Also, this is not an opportunity to circumvent authority and responsibility of the board. Any nurse coming into the territory must and should be known to the board. Our role is to regulate and ensure safe nursing practices. The board understands the need to expedite licenses, but we must complete a process to know competent nurses at your bedside. We cannot give back a loved one to a family after the accidental death by a nurse who was not duly licensed. What we would not like for ourselves, we should not want for others. Most who can afford off-island medical care leave the country and seek medical assistance for themselves or their families in hospitals abroad. However, those who chose to stay with us must be given the optimal care with many limitations that we may encounter. Adding to this will not be done by the board. We all must know that one must be stable before being lifted out of the territory in an emergency
Let us not let it be any one of us in the bed. We understand the pandemic, but VIBNL did not need the pandemic to make sound or rush decisions in nursing practice in the Virgin Islands. The compact will only add safeguard public health. We before you and our predecessors will carry out this role for years. The board will never stand in the way of improving healthcare in the VI, but we will not ignore or limit the requirements and not safeguard your life. VIBNL will seek to have world-class nurses with world-class excellence for our people. Just like our clear blue waters, white sandy beaches, and beautiful people, we want nurses to desire to give the quality of care to anyone who requires healthcare in the territory. Before enacting this bill, we will require some structural changes internally, funding for additional staffing, securing improved information technology services, and many other funding needed to ensure full implementation of the NLC. In addition, all compact nurses must be reported by the employer to the VIBNL within 30 days. Failure to report subject to entity to pay a fine. Healthcare is not a game, and we cannot place a price on a person's life. Nurses can no matter the situations. As we move forward with many changes in nursing, let us not just ensure compact in the Virgin Islands, but an excellent healthcare system. We, VIBNL, remain committed to ensure that we have competent nurses who are qualified nationally to serve in our community. I want to thank you all for the opportunity to present and support Bill 34-0040, and we stand open for any questions that you may have. Thank you.
Thank you very much, Chairperson Penn, for your testimony. Next, we'll go to Attorney Fosh. You're recognized for your testimony.
Hi, thank you, Chairman and committee members. My name is Rebecca Foch. I am the Director of State Advocacy and Legislative Affairs at NCSBN, so the National Council of State Boards of Nursing. We are the drafters of this compact, so I hope that I will be particularly helpful to the committee members with any questions that you may have. On behalf of NCSBN, I'm ready to voice my support for Bill 340040, which authorizes the U.S. Virgin Islands to join 38 states and territories in enacting the NLC. The NLC allows registered nurses and licensed practical nurses to have one multi-state license and practice in any of the other compact states under that one multi-state license. The NLC is a vital tool to address nursing shortages as well as the fight against COVID-19. The NLC enables nurses to immediately cross borders and provide services to help fill gaps in care. This is an important tool to alleviate the nursing shortage in the U.S. Virgin Islands, as well as in times of disaster, like hurricanes, when healthcare staffing is strained due to increased patient volumes and loss of healthcare workers. During the COVID-19 pandemic, nurses in NLC participating states were able to immediately cross state lines and treat patients. This mobile nurse workforce is vital to cover gaps in care, both during disasters and beyond. The NLC has many patient safety provisions, including 11 uniform licensure requirements to ensure that every nurse practicing has been vetted, practicing under the compact has been vetted and meets these statutory standards. The NLC has been in existence for over 20 years and continues to grow. As one of the previous presenters had said, this past year, 3 new states, Vermont, Ohio, and Pennsylvania, and 1 territory, Guam, joined the NLC. Recently, nurses in the Virgin Islands were surveyed to determine their level of support for the NLC. According to the survey results, 96% of those surveyed support the U.S. Virgin Islands joining the NLC, and 95% of those surveys would obtain a multi-state license if they were able. The U.S. Virgin Islands can bring needed relief to its hospitals, nurses, and patients by enacting the NLC. The NLC increases access to healthcare, protects patients, and is a crucial tool to address nursing shortages. Thank you for letting me testify today. And one other thing that I would just like to comment on, there were a few comments from presenters about the costs associated with implementing the NLC, and NCSBN does offer its members grants for that implementation, IT and beyond. So we do have a grant process for that most of the states have taken advantage of as they implement the NLC. Thank you.
Thank you very much, Attorney Fosh, for your testimony. I think that completes the round of testimony on Bill 34-0040. And we'll go to a 5-minute round of questions. But before we do that, we'll take a 2-minute recess. The Committee of Health, Hospital, and Human Services stands in recess for 2 minutes. We're out of recess. This time I'll ask the testifiers to turn their cameras on, and we'll be going to a 5-minute round, and we'll start off with you, Senator Blyden. You're recognized for your 5 minutes.
Thank you so much, Mr. Chair. Good afternoon, and good afternoon to the testifiers, and thank you for your testimonies. So based on the testimony, everyone is in support of this legislation. I want to thank the sponsor for bringing this measure forward. What was shocking to hear, though, is within the last couple of months, from 4 states to 38 states have been acting and joining on. And I believe that speaks volumes in respect to the need of this legislation, as it basically fills the gap. It provides access to care, and it also improves retention and recruitment. So definitely I am in support of the legislation, and of course I might sign on by the time it gets to rule. Let me ask Ms. Williams. Good afternoon. Dana, good afternoon, Ms. Williams.
I can hear you.
Hi. In your testimony, you spoke to amendments. And in respect to the amendment, what's your concerns? Even though I know you support the legislation, what's your concerns? What concerns you? What's the challenge, in your opinion, when it comes to the legislation?
Quite frankly, as we continue to experience the effects of a national nursing shortage, we do recognize that ease of licensing and being expeditious in our licensing process would enhance our current nursing staff capacities here at JFL. But we also recognize that it's not just about the licensing or ease of licensing for our nurses. Often when we connect with our nurses, they want to have homes here locally. They want perhaps tuition incentives or housing support. And so we wanted a real opportunity to look at the comprehensive needs of our nursing staff. And so as much as we do absolutely support this bill provision for the Nurse Licensing Compact Act, we also wanted to keep an eye on the other needs that has been expressed by nursing staff, because we also wanted to pay attention to the recruiting efforts that are equally as important as it relates to the licensing.
Okay, thank you for that. Dr. Maurer, any concerns, even though I know you support the legislation?
In general, I echo the sentiments from ICO Williams. From our perspective, we do support the licensing. There's always, a concern, of course, with any general reciprocity measure, that the same level of assurances will be made throughout to assure that a licensed nurse coming from another home state is going to be under the same level of scrutiny and regulations that we see here, and that in bringing in an individual, they don't pose a risk to the healthcare measures of the Virgin Islands for lack of observance of any infractions that they may have had. Once those assurances are made and the reciprocity is held true, then having access with ease of licensing does provide some level of ability to bring on board nurses at a quicker pace. We don't want to substitute speed again for legitimate nurses that are licensed appropriately and has all the regulatory standards met. But anything at this point, as we're going through a pandemic like this, that allows us the ability to onboard nurses at a quicker pace, does create some level of ease for the hospitals that are under such severe shortages at this time.
Okay, thank you for that. And let me ask, before my time runs out, both to you, Dr. Maurer and Ms. Williams, in respect to your policies and mandates as a result of the Delta variant and COVID-19, what has been the result in terms of your operation when it comes to both hospitals? Since I have you in front of us. Dr. Amaro, you go first.
So as it relates to the Delta variant, what we have seen is an unusual level of penetration into the vaccinated population that has created some concern for further transmission. But what we are knowledgeable about is even though we've seen that that transmission, the vaccinated population still remains extremely protected. The level of transmission is much, much lower. And so vaccination still, I do want to state that vaccination still is a thing to do. But because the Delta variant is so transmissible in the unvaccinated population, it creates more admissions and more need for nursing care within the organization.
Okay, and are you able to keep up with the demand when it comes to nursing care and nurses?
It's been very difficult. I do have to lift up the Department of Health for the provisions that they have provided using agencies such as Hartford Nursing. Without that, we would not be able to manage and uphold the care in the organization, despite the valiant efforts of our local nurses. It is clearly insufficient to manage the dose of admissions that we can get at times because of COVID and the other illnesses that can hospitalize a patient.
Okay, thank you. Interim CEO Williams.
Yes, sir. And so at JFL, we do have our nursing staff and, of course, our other allied health and other clinical staffs that are supportive of the COVID mandate. And, of course, we have those that are not supportive of the mandate. And we do have a concern because we're currently experiencing current nursing shortages and critical staffing challenges. Hence why Department of Health Commissioner Encarnacion has been really supportive from the onset of our COVID response in terms of providing additional staffing support. And so as we continue to evolve through our COVID response and we do see prevalence of the Delta variant, it has become more and more crucial for our team members to be vaccinated to protect to the greatest extent possible from being exposed or succumbing to the COVID virus and, of course, the variant. And so we're currently supporting our staff by providing additional education and really just providing the facts as we are proponents of the science behind the vaccination. We do understand that persons are not necessarily across the board in favor of the mandate, but we do find that it is essential at this time in terms of our overall response to this pandemic. And so we do anticipate that it's going to unfortunately cause additional staffing challenges, hence why one of the opportunities here in terms of this multi-state license is even more crucial.
And based on your responses, thank you so much for your response, and that is the reason why we need to support this bill, 34.0040, and I want to thank you so much for your time, Mr. Chair. Thank you.
Thank you very much, Senator Blyden. Before I go to the next senator, I wanted to ask ICO Williams and Dr. Amaro, in respect to some of the nursing benefits that have been put on the record today, that I certainly support. Some of that requires some negotiation between the unions and within the purview, in my estimation, of the agency heads. What do you believe is a happy balance? Because yes, we want to balance recruitment with retention. What do you propose as a Senate that we can do to reassure, assure, or at least allow for a happy balance between recruitment and retention? Any recommendations that you may have that within our purview?
ICO Williams.
Sure, I'll go first. And so, as a registered nurse myself, often we come back home and we want to have the provisions that we grew up with for our extended families, for our children. And so, it's not just about the work life that you have. You do want work-life balance, quite frankly. And so, when we talk about retention, we look at the ability to afford housing in a market where housing costs are more and more exorbitant. We look at the kind of being hindered in terms of advancing because your student loans may be very plentiful, and that kind of encumbers your ability to apply for loans. And so typically, you look at those provisions that any professional would want if they were to consider relocating and making a place their home. And so our intent here is to support any initiative to that regard in terms of any legislation that would support any banking opportunities, to support housing, to support tuition reimbursements, and that sort of thing in terms of really enhancing a more balanced work-life balance, essentially.
And from Schneider Regional, again, I support what ICO Williams has stated. And from our perspective, I mean, nursing is the same no matter where you're at. They want, their desire to have a fair and equitable work-life balance as they see anywhere else. Of course, comparable to what we have as a cost of living, to appreciate when we are looking at what that work-life balance would be and what the compensation level would be. I think this does play into the compact in that, one advantage that I see with the compact is a nurse here would be able to easily migrate to another institution and gain new skills because of their ability to work in other places, other practices, and hopefully, if they know that we have a compensation level that's equitable to other places that they do visit, they will then come back, bring those skills home, that level of experience that would be added to the culture of nursing and the things that are all nursing for the care of the people of the Virgin Islands. I can see that as an additional advantage. But so once you fix that compensation level, then the compact becomes less of a risk of losing our nurses to other places other than for them to gain that experience. We would gain folks coming in, and hopefully we would gain individuals who leave to then come back because it's not such a loss.
Very well. Thank you for that. Commissioner Encarnacion, would you like to weigh in? Coming from a nursing background yourself, would you like to weigh in on this? Because I think it's important that we balance this discussion as we talk about recruitment and retention.
I think that everything that's being said actually should be considered. I think that I was actually the recruiter from one movie hospital when I went back there. So actually recruited Diamond Williams back to home. And so I have to tell you that retention is just as important or sometimes more important than recruitment. So we have to make sure we put things in place. There's a lot going on right now. I know that the clinical team has a little bit more knowledge than the general public, and so information that they want to gain. For example, nurses are asking why is it that, or clinical staff is asking why is it that we are mandating at this point in time, and it hasn't been fully approved by FDA. Unfortunately, we do not have the time to wait. It is a pandemic, and being in a pandemic, of course, we have to have, we focus on community immunity, right? Rather than herd immunity, which is critical. 75 to 80% of the population would have to be immunized in order for us to gain that full herd immunity. Community immunity, same thing. It's basically the same premise that we're looking at. But if the highest percentage of individuals in our community is vaccinated, then it allows a decrease of the transmission of the virus. And, one of the things that you said in the earlier testimony, you indicated that the life that you save may be your own life. And we hear stories every single day of individuals testifying at the end of life, indicating that they had a choice. They would indeed have been vaccinated, not only for them, but maybe exposing their loved family members that are older or more severely compromised in some fashion. And so now we are at the point where decisions really have to be made. And I just from an overall perspective, we have to make sure, one, in reference to personal decisions, taking the vaccine, from a professional standpoint, working with both hospitals to ensure that we have the number of staffing needed in those hospitals to take care of the patients that haven't been vaccinated and are admitted in our hospitals. Thus far, we have not had to care for any vaccinated patients within either of our hospitals. All of them that have been admitted thus far have not been fully vaccinated. We had one that had one vaccination. I'm not sure if we had others, but one for sure had only one of their initial vaccination vaccine, but not the second dose. And so, of course, that level of immunity did not build up at that point in time. So we're really looking at a state in which, and one of the things that Dr. Ellis identified, let me step back, to indicate that we are the state and our territory. We are the territory with the least percentage of vaccination. However, we are the territory with the highest number of positive persons per capita per day. So one actually says why we are where we are in terms of our positivity rate. And lo and behold, our positivity rate has stayed below 6. A lot of areas around us have a positivity rate above 10 and beyond, even though their vaccinated rate is higher. And that is because our epidemiology department, our CDD division, we are actually working so hard with our testing. As the higher the number of tests that we do, the lower the number of positives, then we can balance our positivity rate. However, we still need to make sure we increase the level of vaccinations we see within the territory. The vaccinations, hand washing, social distancing, of course, wearing masks at times when you are in a close contact, even if you have been vaccinated, is critical for getting us out of the pandemic. So it's not that we want to mandate just for the sake of mandating. It's that we want to make sure that we have a life to talk about after this pandemic is over.
Thank you. Thank you very much, Commissioner, for your point on that issue. I think it's critical that we're able to put that on the record as we continue to contemplate and balance this discussion regarding recruitment and retention. At this time, we'll go to Senator Johnson. You're recognized for your 5 minutes.
Good afternoon. Good afternoon. Good afternoon to all testifiers. Good afternoon to my colleagues. You know, it's not an easy road today. And I first of all would like to start off by saying thank you very much to all the nursing staff there at the hospitals in the territory. Because without you, I don't know where we'll be. But I also must say that I want to make, for the record, I am vaccinated. I got my 2 vaccinations. I got my antibodies and everything like that. But prior to the vaccination, our nurses that was on the floor practicing without vaccination have been doing everything to create that environment for safety for themselves and their family. And I'm not a person that supports mandatory vaccine. And I make sure I just put it on the record that I am vaccinated. But I also believe in freedom of choice and each one do what's best for himself. And there's different beliefs, religious beliefs, different type of beliefs as to why a vaccine is good or isn't good. I made a personal choice, and I made that choice without any fear or anything like that. But I don't want to ever hear that if our nurses don't vaccinate, they're gonna go home. That's one thing I definitely don't want to hear or will accept. And we must meet someplace in that borderline where we make sure that all is safe and all is protected. And after, with all of that said and done, I need to ask this question. Are our wages competitive enough to attract outside nurses? And if not, would it be a risk with the territory losing nurses leaving under this act? Anyone of the professionals, Ms. Williams or O'Mara or even the commissioner? Anyone that have that information?
Well, I'd like to speak with that first, if I may.
Yeah.
ICA Williams, if I may. Okay. Let me just say no. Right now we're not as competitive as we should be. But what I wanted to say and speak to is that the governor has actually spoken with our bargaining units. Well, basically our office of the chief negotiator, let me just say, and she's actually now working with all of the unions as well as the representatives to ensure that we increase the level of pay specific to the various entities. So that is, we're hoping to correct it as soon as possible from an administration standpoint. I'll say that, and then of course turn it over to either of the ICOs to continue.
Thank you very much for that information, and any other CSO might continue to.
Certainly, I'll go first. And so I do agree with Commissioner Encarnacion. There's opportunities for us to look at the national pay scales and to ensure that our nurses locally, their compensation is as competitive as that of the mainland. I'll also include that right now, as a direct result of this global pandemic, a lot of the states are offering significant bonuses that is well beyond the salaries that are our traditional salaries. And so that really makes our recruitment and retention that much more challenging when persons can, make upwards of, $20,000, $50,000 in a relatively short period of time, even if all they do is leave for maybe 6 months to a calendar year. And so I think the retention, and when we speak to our nurses in terms of what would make you happier, how could we kind of meet your needs? We're bringing in staff to work alongside them in the same organization, and they know what those support staff personnel make. And so really and truly, our desire is to make our nurses feel whole, as we know they stand in the gap, for every natural disaster during this pandemic. And it's really important that we kind of honor their sacrifice, their time away from their families, the fact that they're standing in the gap and they're facing, whatever comes to the door, essentially, by, really making sure their compensation is as competitive as it can be.
Senator, if I may also add to that, as early as this morning, the governor indicated that he is setting a meeting with both ICOs and myself to discuss compensation for the clinical staff to ensure to compete with the other states as well, because they are doing it, and we need to figure out how we're going to compensate our nursing staff and clinical staff here within the territory. So that is a conversation that will soon be had.
Dr. O'Mara?
And to that extent, I think that a lot has been said there that's right on point. We do have a meeting set up in the morning to discuss these very measures, but it's important to remember that there is a difference between compensating according to an emergency and compensating according to employment. When we have to look at employment, we are not looking at just, a lot of these ads and so forth that you see focuses, say, maybe on critical care nurses or RNs. We have to look at all levels, including the leadership of nursing, so that we don't run into a compression factor. 1 minute. In the salaries that we provide. We have to look at all our nursing levels to make sure that it is equitable and that everyone gets a share. And then we have to look at the long-term effect. A lot of what you see out there are temporary salary measures. When we institute stuff through our CBAs, you're talking about a long-term effect that has to be sustainable. And our operations and our financial constraints, our payer mix, don't allow for a long, sustainable, high salaried measure if it's not going to be able to flux down when the pandemic, tails off, as we pray that it will. These agencies are able to flex that up and down because a lot of it is temporary measures in support of other hospitals. So knowing those differences does have to play into the mix of how we compensate. Nevertheless, it is important that we realize that our not only our nursing staff, that's the other thing, it's not just our nursing staff, you know, the physicians, the ancillary staff, our lab, our radiology group, they're all working overtime, they're all working as part of that. And they're all keeping a very keen eye on what's happening when these funds go to one division, and we don't want to hurt that morale either. But that should not affect, you know, what we need to do to be competitive, to bring in whatever division is hurting in the care of numbers.
Thank you very much. You're right on target. I definitely appreciate hearing that there are going to be some dialogue in reference to wages to make sure that we don't lose the little bit of numbers that we have. And Mr. Chair, if I could wrap up with this last question. And again, anyone who can answer this question, how long would a traveling nurse assignment be able to practice in another state?
I'll start by saying when we get our travel nurses, typically and outside of consideration for the pandemic, it's usually a 13-week assignment that when we bring them in. As far as what they may get outside in another institution, I wouldn't have that information.
I think is Rebecca Fawcett. Can you answer that question? If I may, Mr. Chair.
Attorney Fosh.
Sure. The compact doesn't limit the time period at all. So it would be dependent on the hospital and what the hospital decides to contract, the term of the contract for between the hospital and the travel nurse. But that is not limited, or the compact doesn't speak to those contracts at all.
Thank you very much. And in closing, I'll definitely like to say thank you very much to all the nurses in Wang Louis Hospital. My uncle was there and spent some time there, and wasn't a good experience because of the pandemic that took place in the hospital. But he made it home Sunday, and Sunday was his birthday. He made 92, and I thank God for that. And happy birthday to Uncle Al. Wish him all the best. Thank you very much for the people in the hospital, for all what you do for the people of the territory.
Thank you. Thank you very much, Senator. Next, we'll go to point of inquiry, Senator Vielle.
Thank you, Mr. Chair. Now, I wanted to go to a point of information because we really have to be careful as we move forward, because there is a big difference between somebody who is employed full-time at the hospitals versus somebody who is here for a short period of time on a contract. So when you're looking at the numbers, you have to be very careful in terms of your ability to sustain whatever you're going to implement. Right now, Commissioner Encarnacion, the contract nurses that are coming to the Cinco, we're paying them with federal funds, correct?
Correct, sir.
And in fact, if we were not paying them with federal funds, we would have a tremendous issue in being able to bring them on at both hospitals. Correct, Ms. Williams and Dr. Amaro?
I would agree.
So
that is correct, Senator.
We have to look. You look at the overall budget. You look at what incentives you could literally give to be comparable with other states that have full-time nurses at those hospitals versus being comparable with a contract, because the contract is totally different. It's for a short period of time. Those individuals could be dismissed after 2-3 months working for the company. It's based on the particular need. And then lastly, I wanted to say that Dr. Amaro, Daima Williams, Dr. Commissioner Encarnacion, they're in leadership position in reference to public health. So their discussion must be different. It can't be popular. It got to be based on the science, it got to be based on CDC. So we can't expect them in that particular position to make positions that are popular. They can't even make decisions that are political. They got to make decisions that is in the best interest of public health. And some of those decisions are not going to be what we like, but they're charged with that. Because if your leadership in public health don't make decisions that is in the best interest of public health, then that jurisdiction or that country have serious problems. Thank you, Mr. Chair.
Thank you very much, Senator Vielle. At this time, the chair will recognize Senator Frances Heiliger for her 5 minutes.
Good afternoon, colleagues. Good afternoon, testifiers. First of all, I don't know if I missed it, but I need for you to tell me locals that are living here versus the traveling nurses. Does anybody have any numbers from each of the hospitals?
Senator Heiliger, I don't have any of the hard numbers here with me, but I will share that outside of the Pafford staffing, we are largely locally hired. We don't have a large component of travel nurses here at JFL.
Okay, and Schneider Regional?
I will defer to my Executive Director of Human Resources, Ms. Walda Mason.
Hi, good afternoon. Ralda Mason, Executive Director of Human Resources. At Schneider, we have about 85 registered nurses on our roster as regular full-time nurses, or as an FTE count. And then we have approximately 10 agency nurses, and then we're supplemented with Pafford nurses who are supplemental for temporary as well.
Okay, thank you. I was listening here to the dialogue earlier in regards to the mandates put out by our health institutions. And I am a supporter of anyone that chooses to be vaccinated. I think if people have listened to what the public has said, what has been put out, and they have made the choice and decided that this is in their best interest to protect themselves, I think that's 100% to go. I literally came off the phone with my own sibling who had COVID, and she called to tell me that she was at CVS taking her first shot. And I said, congratulations. If you have read all the data and you think this is in your best interest, your sister, who is mother and father, grew up with her, will support you. But I also have to realize that a representative of all of the people of the Virgin Islands, I have to also be mindful that there are some in our community that opt not to be vaccinated. And I think we should not be in a situation where their liberties are being trampled on in a way it almost seems that things are being said and done to take away their ability to choose. And that is a concern for me. I have taken the time out and spoke to many of the nurses, and I've even participated in some of the protests. And if these are the same individuals and doctors and nurses and people that went through the pandemic, did what they needed to do to protect themselves, to assist many people, why do we not trust their judgment to say, guess what? I would also like to have an option to say test weekly. Is there a reason why the option for testing weekly has not been offered to the nurses, as opposed to just saying you either get vaccinated or you get fired? Because for me as a representative of both the vaccinated and the unvaccinated, that scares me. Because I don't want our people to be in a situation where you're telling them, if you do not let me stick a needle and put something into your body, you cannot feed yourself. If you do not let me put a needle and put something into your body, I will take away the ability to take care of your children. If you do not allow me to put a needle in your body and put this vaccine in your body, I will take away your ability to put a roof over your head. I don't like that narrative, and that is where my concern comes in. I understand what is happening in our community with this pandemic. I do what I have to do, whether it's wearing masks, washing hands, moving, I do it. And a lot of people in our community do it. But as much as those that are vaccinated can also contract COVID and also spread it, I think unfortunately there's a false narrative from my perspective that is being put out there that once you are vaccinated, that all is okay. That's not the case. We still have to do the things necessary to protect ourselves. One of the things that I felt the CDC did, in my opinion, that was not good, is when these vaccines came out initially, take off your mask. Everybody just, we could do whatever. But what I have noticed is every time a mandate has been put out, some information has been put out temporarily at the time, it gets changed. I remember when this pandemic first started and we didn't know what was happening. It was everybody don't wear masks because we need to leave the mask for the healthcare workers. Then it was everybody wears a mask. Then it's the vaccine. Everybody who wears got the vaccine. We don't need to wear masks. It's too much information because we are learning as we go along. And I don't want to be stuck in a situation where we're so gung-ho at this moment on vaccinating and nothing else, that 6 months from now, it's a totally different narrative that's being put out to the public. I am 100% in support of those who have been vaccinated. But I represent the entire Virgin Islands, and I cannot ignore the voices of those that have said, listen, I want an opportunity to wait to see when the FDA has decided to approve this, then I'll take the vaccine. I cannot ignore the voices of those that say, I have theories. I cannot ignore the voices of those that say, you know what? I have read a lot about this, and at this moment, I do not wish to do it. I'm not saying I'm not going to take it later on. So I'm asking you, the same way that this institution, they have mandated it as well for the employees, but they gave them a choice to take tests weekly. The government has done the same thing under the executive branch. The federal government has done the same thing. So I'm asking you, explain to me, when the same nurses that battled this pandemic and help us get through it, how do you take away their choice to decide whether they want to take it or not, or they cannot feed themselves? That is my concern. Thank you.
Thank you very much, Senator Frances Heiliger. Next, we'll go to Senator Gittens. You're recognized for your 5 minutes.
Chairman, can you give me some time after, and you can let me know when? There's something
Commissioner,
that
you could go at this time, Commissioner.
Set after the senator spoke. So when I can, please allow me to.
Commissioner, you could go at this time, and then we'll come back to Senator Gittens. You may proceed.
Thank you. I appreciate that. In terms of false information in reference to the vaccine, I think it's important to note that vaccines actually do save lives. It's proven throughout the world that vaccines actually do save lives. We spoke a lot about vaccinations and viruses and the way viruses actually replicate. And I do not have Dr. Ellis or Dr. Hunt on the call today. However, viruses actually replicate and duplicate. That's where you have the variants. And that occurs when you do not have the immunity level around you to prevent that duplication or the variants actually being replicated. So because of that reason is why it's so critical for us. The Delta variant would not have been around had we had throughout the world. It's not just the VI or the nation, but throughout the world, had we had the number of immunity or high level of immunity that's needed to suppress that transition of the virus from one person to the next, as well as the mutation. The mutation takes place within the body. So that's really what the intention is. That this is a pandemic. This is not just the annual flu that we're talking about. And yes, people's rights and really has to be heard of. But one of the things also, patients also have the right of being safe in a hospital environment. And there have been some exposures, not just here within a territory, but nationally and worldwide, in which some individuals have been admitted and contracted COVID-19 from a healthcare provider. And so that's one of the reasons why we're the board, I can't speak with Chairman Finch, he's not here, but I am a member of the board, and that's one of the reasons why the board is acting in the way that we are acting at this point in time to not just support the territory, but support the patients as well as the staff within the hospitals. But vaccines have proven to save lives, and I agree, it's not just the vaccine, the masking, the social distancing, and the hand sanitizers and hand washing. It's the whole gamut that actually produces that. But the vaccine reduces transmission and allows you to live a healthy, a safer life without high incidence of illness or death. Thank you for the opportunity, Senator.
Thank you. Thank you very much, Commissioner. At this time, yes, Senator Sarro, you are recognized for your 5 minutes. Right in time. One second. Senator Francis Heiliger, you had a comment? A point?
Yes. I wanted to do a point of inquiry at this point. I had asked a specific question that wasn't answered when I had stopped speaking. I asked the question, is there a reason why, like other governments, to include even us here in the first branch and the second branch, is there a reason why weekly testing was not an option for the employees at the hospitals? Thank you.
Thank you. That will go to ICO Williams and Dr. O'Mara.
Good afternoon, and thank you for that question. We are currently, meeting with the board and looking at all options. We certainly, I have to echo what Commissioner Encarnacion said. The goal is to prevent transmission. As healthcare workers, just as, if you read my recent article in the Daily News, when you enter certain fields with a certain level of responsibility, you're going to enter that field to carry on the mission and duties of whatever that responsibility is. As healthcare workers, and as a physician, our first motto is first do no harm. In so being, the first goal is at the highest level, what is the best and latest model for preventing transmission of this pandemic, of this disease? As the data shows, that best level as an additional tool to the other things that are being done, including masking, social distancing, hand washing, and all infectious control measures, that now additional tool has become by very clear evidence, vaccination. Now, if you are unable to vaccinate for reasons that are stated within the policies that are currently under development and have been handed out, then we are looking at what is the next best thing to prevent transmission. Weekly testing would be an additional tool. It would be an addendum type of tool that we can look at to prevent transmission. However, let it be known that you can test weekly. If you test on a Tuesday and catch the virus on a Thursday, you are now going for an additional 3, 4, or 5 days of transmitting that disease to another individual before you test again. And even testing that next week may not reveal a positive result because it may still be too early. And you may go an additional week of transmitting that disease to patients in the hospital who came in COVID negative and are expected to leave the hospital in a better state, and you have now posed a potential of making their health status worse by transmission of that virus because your test has not yet become positive. These things are looked at very carefully. We've never done a mandate before of this proportion, but we've never had a pandemic of this proportion. And so those individuals who come in for treatment have a right to be treated and have a right to not contract the virus when they did every measure possible at home to prevent contracting the virus. And now because they had an unrelated viral illness, they had an unrelated illness not related to the virus, and they came in and now they contract the virus in the hospital from a hospital worker who did not vaccinate, that becomes something very difficult to defend against. And so from that perspective, we may look at weekly testing and put that in, but it is certainly not the best practice of medicine by the standards of what is looked at as clear evidence.
Best practices, just quick question. I'm asking this question. Best practices as a hospital. If you're saying that the unvaccinated weekly testing could potentially drag on a potential COVID outbreak, the question would be, well, then would it not be best to test everyone? Because it's already been proven that those that are vaccinated can also have COVID and be spreading it throughout the hospital. But I thank you for your answer, and I hope the board does look into it. The other young lady, I'll take her answer, and thank you for the additional time.
Thank you, Senator Francis Heiliger.
If I may, this is ICO Williams, and so I would echo the sentiments of Dr. Amaro and Commissioner Encarnacion. I think within the healthcare arena, the rules of engagement are distinctively different. I will share with you, as a registered nurse myself, I could not even enter nursing school without mandatory vaccines. And it is long been a standing provision of healthcare providers to be vaccinated so that we are not inadvertently exposing our vulnerable patients that come to us with other healthcare issues and inadvertently exposing them to illness that they did not present with. And so vaccines, quite frankly, have been a hallmark of healthcare since the beginning of time. And as we continue to evolve through the pandemic response, yes, there has been implementations that have been instituted that has also evolved. And that's what we're doing in terms of being top of mind and as agile and responsive as we need to be to the rise in our community. We've now, for the first time, gone above our 5% mark, which is, again, a red flag for us, as is the hospitalizations on both islands. That is another hallmark that we're looking at in terms of our holistic response as a territory. And so as we look at our markers and what tools in essence are available to us in terms of curtailing the spread of this pandemic, mandatory vaccinations is one of the tools that we've instituted in terms of, PPEs and social distancing and masking. 100% of that is applicable in the healthcare arena, as is vaccination, as we've historically done. And I will share too that the Delta variant is one of those additional considerations to be most effective in terms of testing, specific to your testing question. To be most effective, you would essentially have to test every other day. And look at the resources that you would need to have readily on hand to test your clinical staff every other day as well, which is in itself is not necessarily sustainable.
Thank you, CEO Williams. Senator Saru, you recognize for your 5 minutes.
Thank you, Mr. Chair. And I stand in support of the legislation. I understand the fight and the debate between pay for nurses and those who are on contract, and it's a national issue that hospitals are losing nurses to agency nurses. I have a friend who makes $11,000 a week. She left the hospital that she was at, and she returned to the same hospital as an agency nurse. And another friend who was deployed to Texas, and in the 4 weeks in Texas, made over $150,000, and will be returning in short order for the same. So it's not, I don't want us to relegate the issue to just a local issue. And I know there are a few nurses there that can attest to this. So the $20,000 that Pafford is offering for the month is in no way in comparison to the offers on the mainland. But it also speaks to a larger issue too, and I do commend nurses for the work that they do. But it speaks to a larger issue how people have to become educated and take education serious. And that we cannot always, I don't want to say look for a handout, but most of my peers, a lot of them are selling T-shirts and promoting jams, and this is the things that they're doing. And then you have the educated just, doing what they should be doing. And educated means that not only a formal education, but those in the vocal areas, doing their thing. I want to go to the vaccine discussion, and I could only speak in my language, political science and history. And of course, the American Revolutionary War began. And in 1790, of course, there was a smallpox outbreak. And George Washington, with their indulgence, I may go over time for 30 seconds. George Washington, the soldiers were dying from smallpox, and the objective was to beat the Brits because America wanted to be a new nation. So in 1796, smallpox vaccine came into play, and George Washington was the president that made vaccines mandatory for our military. As you go on, and of course in 1914, World War I ended, the Treaty of Versailles was signed, and 20 million people died in World War I, casualties of war. But following World War I in 1918, you had the flu pandemic that killed triple the amount of people that died in World War I. And then historically speaking, 1796, the smallpox vaccine. 1885 came the rabies vaccine. 1890, tetanus. 1896, typhoid fever. 1906, TB. 1932, the yellow fever. 1937, the flu vaccine. 1952, polio. 1963, measles. 1969, rubella. 1974, chickenpox. 1979, meningitis. 1981, hepatitis B. 2006, HPV. 2019, both Ebola and dengue vaccines. So some people opt out of vaccines, and they do so in modern times because vaccines were able to eradicate those illnesses. And then let's move to the legal argument. The legal argument is that the precedent for mandatory vaccines it dates back to a 1905 Supreme Court case, Jacobson v. Massachusetts. And via the Constitution, specifically Amendment 10, it allows the states to invoke that amendment, and it gives the state the police powers to act to prevent an epidemic or pandemic within reasonable action. Furthermore, you can't argue Amendment 14, the Equal Protection Clause. 13 abolished slavery, 14 equal protection, 15 gave the right to vote. Well, actually, citizenship, right? Those are the freedom clauses as we go by. And when you get to 13, abolishment, citizenship, the right to vote, there is no due process, because when it comes to the health and the welfare of the state has a compelling interest. And any compelling interest or interest of the state, that abridges individual freedom. It trumps individual freedom. In essence, the state has the right and the obligation to protect the greater good. So I am not out here advocating, nor do I support the $800 for a vaccine and $100,000 here for our next vaccine. I just want to present the historical data and facts and speak in the language that the people could understand. I am not speaking opinion here. I went back to when the nation was founded. And George Washington knew that to preserve the Union, to beat King George, no taxation without representation. He knew that he needed to protect the military. After World War I, we knew that people were dying at alarming rates. Vaccines have been proven then and now. And the last point is, in the National Institute of Health, Kizzmekia Corbett is the leading immunologist, a black girl from rural, either North or South Carolina. And it would be, we understand the Tuskegee experiment and all of that, but we cannot negate the advancements in modern medicine. We really cannot. A woman of color led the charge. And all this, who are we, the non-scientists, to go and discredit the work of the scientists. We have to stop doing as a community. So I am not infringing upon your personal freedoms, but your freedoms end when the state has to protect the greater good. So I understand all the vaccine discussions, but it nauseates me. It really does.
1 minute.
When we go back and forth about individual freedoms, you have the right to freedom of speech. But your freedom of speech ends when you begin to engage or cross the line of demarcation to slander and libel or to threats that affects the national security of the state. Freedom of speech is only pertinent to the government. You don't have the right to say what you want to an individual business. That's why people get sued over and over. And it seems like we need to take a course in civics and government because this is Government 101 constitutional law. And in a democracy, freedoms are not carte blanche. They don't just extend everywhere. The state has a duty in matters of public health to do as they must. So to our healthcare professionals on the screen this afternoon, thank you. Thank you for your service. Mr. Chair, I return the balance of my time.
Thank you, Senator Saru, for the public announcement. Senator Gittins, you recognize for your time.
Thank you, Mr. Acting Chair. Good afternoon to all. Attorney Fosh, it's good to see you again on camera. How's the little one? Last time we were able to see the little one. Hopefully before you leave, we can say hi.
They're both good, and I actually have another one on the way. So.
Oh, wow, you've been real busy. All right.
Apparently.
Thank you that you're able to join us again with this legislation that I still can't understand why it's not enacted yet. But we now join the rest of the nation with some almost 40 state and territories that's already part of this compact, and I truly appreciate your testimony, especially from the national level with regards to the nurse licensure compact. And I'm certainly happy today to hear from the VI Board of Nurse Licensure that they are now in support of this measure, as I believe they've said some 97% of the number of feedback that they got were actually in favor. Thank you for that testimony. So, as you know, and colleagues are aware, I'm a co-sponsor of this measure and supported the primary sponsor from day one with this measure. So I'm not going to stay on it. I'm just ready to vote on this measure so that we can get it enacted. But I'm going to go back. I heard a lot of thanking of our nurses for the job that they're doing during this pandemic. But I keep saying to everyone that thank you does not pay the bills, nor does it show true gratitude. I want to remind everyone, department and agency heads, that Act 8327 grants up to 80 hours paid leave for certain government employees who are quarantined or whose health may be affected by the pandemic. It is truly disheartening to continue to field calls of individuals who have to inquire, aren't they supposed to grant us paid leave if we were to contract the COVID virus, why are they charging my personal sick leave, etc.? I want to again remind agency heads and department heads that that should not be happening. And one thing that this senator did as the primary sponsor of this piece of legislation was wrote to every affected department and agency head and CC the copy to every human resource entity under their leadership. Today, August 17, 2021, we should not be going back and forth with this. We're thanking our nurses one way, and we're giving them hell another way. And that is not a good feeling with these individuals reporting to work each and every day under the extreme circumstances. So I say let's continue to look out for those that's looking out for us during this pandemic. I have also submitted a bill draft to legal counsel not once but twice, the last legislature and now this one, to establish a coronavirus preparedness and response supplemental appropriation act, because it was just stated, we're giving incentives for shots and incentives for everything, but we're not taking care of those individuals who are on the front line that has to be in the line of fire with this pandemic over and over and over again. As we look at it nationally, we're seeing where other states are able to actually give an incentive pay to nurses, first responders, etc. during this pandemic. And while we're talking and having all these press conferences and briefings and whatnot and talking about the influx of federal monies coming into this territory, it is high time for us to decide to look out again for those that's looking out for us in this territory during this pandemic. So I will be working with the Office of Legal Counsel to try to push forward this measure. I'll discuss it some more with colleagues and whatnot, but I think that we need to push this through so that while we're talking about looking out for our own and looking out for our local nurses, this is one way that we can definitely look out for them. And at the appropriate time, I am poised to definitely support this bill number 34-0040, amending Title 27 of the Virgin Islands Code as establishing the Nurse Licensure Compact. I'm ready to vote for that as the motion is made. Thank you, Mr. Chair, and thank you, colleagues.
Thank you very much, Senator Gittins, for your line of discussion. No questions this afternoon. Thank you for your statements. At this time, the chair will recognize Senator Carla Joseph. You're recognized for your 5 minutes.
A pleasant good afternoon, and thank you, Mr. Chairman, and a pleasant good afternoon to my colleagues, as well as the testifiers and the people of the Virgin Islands. I am not a member of this committee, but I deemed it necessary to be here to lend my support on this critical measure, as I see it as substantive and a game changer to assist in meeting the critical needs in our community relative to nurses. I would like, of course, to commend the primary sponsor of the legislation for his fortitude, because this measure was brought before us at our May 4th legislative meeting, but he had a level of discernment based on what he was hearing from the nurses in the trenches about giving them an opportunity to review as well as to provide comments on this piece of legislation, knowing that they would be the entities and the persons to be impacted by this piece of legislation. I have signed on as a co-sponsor, and I have done a lot of diligent work as far as communicating with those persons who are directly involved in the implementation of this bill should it become an act. And so I would like to begin my questioning with the Board of Nurse Licensure, Ms. Penn, and your executive director, to ask you clearly, given that you are going to be at the helm involved in implementing this legislation, do you see that you can do it with a level of expeditiously? You can do it expeditiously, given where you sit as the Board of Nurse Licensure. Do you see that you can do it, especially knowing that there has been comments that you will be able to also receive grant funding? Can you and will you be able to implement this piece of legislation? Because you would be one of the chief partners to do it. Mr. Chairman, could you hold my time while I
Please
wait?
hold the senator's time while they activate the device.
Good afternoon, senators. This is Carmen Vanderpool Romney, Executive Director for the board. Once there are, as we mentioned before, funding and local structural changes done, we should be able to implement it because most of the work is going to be done through the National Council. They are the ones who will be assisting us with the implementation. But to expedite what is needed, especially in the IT infrastructure locally, after they have done their part, these little things are actually what we would be needing help with, as well as staffing locally. Other than that, I don't think we will foresee any problem.
Executive Director, we're having a very difficult time understanding you. You need to either get closer to the device or something. We're having a difficult time understanding you. Try again, please.
Based on implementation of the compact nurse, and most of the legwork will be completed by the National Council of State Board. What will be required of us locally is some changes in our structural setup and also our information technology division locally. The IT part for compact will be done through national, but after that, we definitely need funding for that and the staffing that we would need extra. Currently, we are understaffed.
And do you see that given the work you're interfacing with the various entities that you have to interface with to get the extra staff and do the like, that will be done in a judicious as well as be implemented quickly and move along quickly. We want to make sure that when we pass legislation that and funding especially, that it doesn't just sit there because of bureaucratic red tape. Can this happen? And what would you say would be your best guess estimate in implementing the nurse licensure? And
okay, there are a lot of steps locally that are beyond the control of the nursing board. For one, the IT structure is done through the government and the Department of Health. Secondly, our staffing is done through the Department of Health, so we cannot answer to that. And thirdly, I think if we have, or we also, like I said, there are certain internal structures that really needs to be implemented to proceed expeditiously with this project.
Okay.
There are other things that's not being mentioned.
Now, my next question to you would be relative to the funding that was mentioned on the national level that is available. How is that going to be managed? And if you could just, before you answer, I went a little bit ahead of myself. If you could answer from the national level, how much funding do you provide territories and different agencies to actually assist with the implementation of the NCL? The NLC, sorry. And this question is directed to the national board.
Sure. This is Rebecca Foch with NCSBN. We don't have a specific number that we cap the grant at. It depends on each state or territory. And what we ask is that the boards of the state or territory give us an itemized list of what they will need with the costs, and our board of directors then approves that. We have never had an instance where the board did not approve any expenditure for a state to implement the NLC of the 38 states. So if something is needed, we are here to help and to fund.
Okay, I don't know if my time has been called.
Time.
One more question and I'll just wrap up. Again, I just want to ask the question, in your best estimate, attorney, tell us what the range has been from the lowest to the highest that you have given a grant to assist in implementing the NLC.
So unfortunately, I don't have those numbers in front of me. I could certainly submit them after the hearing, but I know it has been, some states have not needed anything because their IT infrastructure is, very modernized and has been able to kind of seamlessly implement the compact. And some states we've had to, we fund temporary workers to help with the implementation process, upgrades to IT systems, which can be very costly. So I unfortunately don't have hard numbers for you, but there is a big range, but that's, expected. And I know that the Virgin Islands Board of Nursing and NCSBN's IT department have been in conversation already about what would potentially be needed. So I know that, I'm confident that we would be able to help and fund anything that the Virgin Islands would need.
Okay, thank you so much, Mr. Chairman. I appreciate it. I stand still in support of the measure. I think it's a great game changer to meet the critical needs that we have here in the Virgin Islands for nursing. Thank you kindly, Mr. Chairman.
Thank you very much, Senator Joseph. Before we go to the bill sponsor, I wanted to ask ICEO Williams and Dr. Morrow, what are some of the complaints or challenges that have been brought to your attention by your nurses and your staff as we continue to go through this unprecedented time and the pandemic?
I'll go first. I assume Dr. Amaro is pausing for me to go, so I'll go ahead and go first. And so we have had huddles with the staff. I've had the opportunity to do a few walking rounds, and our staff has essentially said that they're overwhelmed, they're exhausted. We've essentially gone from the hurricane seasons of 2017 in a building that, quite frankly, was damaged significantly by those storm systems. And as we look to build JFL North, we continue to provide quality patient care in a facility that is, quite frankly, physically taxing. And so our team members essentially has said that they're overwhelmed, that they're exhausted, Because we've had such a high turnover rate of our clinical staff, we have our nursing team and our frontline staff assuming more patient load. So our patient ratios, before we had maybe 5 patients to 1 nurse, we're now looking at staffing ratios that are considerably greater, of having maybe 6 or 7 patients to 1 nurse. And that in itself is very overwhelming. And so our staff essentially have been sharing with us very openly, very candidly, that they do need additional staffing support. We have had an opportunity to offer a COVID differential. I think it was March of 2020, as a result of the onset of the COVID pandemic, to really offer an additional incentive for those team members that deal directly and exclusively with the COVID patient population. And that's something that we tried to institute just to give them a modicum of appreciation. But of course, that is not the only thing that that they need right now. They need the additional staffing support. And as we indicated, just a more cohesive work-life balance, as much as this COVID pandemic has made that a challenge.
Very well, thank you. Thank you for sharing that. Dr. Amaro?
Thank you. And from our end, certainly those measures are mirrored here in Schneider, but additionally, well, right now, as far as complaints go, the hot topic that we've been talking about today relates to the vaccines and the mandate and those nurses that do not want it. We've had a lot of challenges as it relates to that topic. I want to really commend Senator Serow for putting into perspective, quite eloquently from the perspective that she did, what this whole thing is about. And I try to have them focus that it is not really about me anymore. It's not about you anymore. It's about the greater good and the public health measures that trumps all things as it relates to personal rights, akin to the mandates or the laws made that you cannot smoke in a restaurant. It's your individual right if you want to smoke a cigarette, but not if it impacts and creates secondary cancer or secondary smoke effects to individuals in a public health measure. And so I applaud the talk that was given there. But that is one of the chief things now that we're dealing with. But aside from that, it is the staff shortages and the challenges we have with bringing individuals in, the work-life balance and the compensation. I think that we approach an equitable compensation, but not as it relates to the cost of living. I think everyone on the island, in the territory, faces a cost of living issue when it comes to their compensation levels and how to manage being able to purchase a home or even sustain the exorbitant apartment leases that are on the island presently, that nurses and other professionals have to face. If I can tout, and I know that I'll get the backing of ICO Williams with this, having an antiquated EMR is not helping, and we have put forth in our budget hearing many times that we would like to move to the Meditech Expanse to make their work a lot better. And so measures like that and their work within the organization would be a lot better when we advance our technology. As much advancements as we've made, there are many things capital-wise that we can continue to make as we are able to afford those things. So that's just a number of things. I can go on, and I'm sure they can as well, but a number of the hot topics that we see on an everyday basis that we try to manage.
Thank you very much for that, Dr. Amaro. I think it's critical that we share that information. Nurses are overwhelmed, a lot of it because of the facility situation. They're exhausted. Certainly staff and support, work-life balance, vaccine concerns, cost of living issues, and compensation, antiquated EMR and technology. I made some note of those things as we continue to have this discussion about how do we deal with the whole system of healthcare and address some of the issues. I wanted to ask the nurse licensure. either Nurse Penn or Executive Director Vanterpool, if you, I know that your role and responsibilities are a little different in terms of licensure, but in terms of your engagement with your folks, what are some of the similar challenges or concerns that have been brought to your attention?
Well, good day. This is Ms. Penn. We have had a few concerns brought to us by the different entities, nurses. We encourage them to speak to their place of employment, the collective bargaining agencies, units, to express whatever concerns that they have. We also inform them that the board deals with licensing and judiciary issues regarding patient safety and the public. However, the concerns that they're bringing to the board reflects internal issues. We recommend that they speak to the agency heads again, and as well as the collective bargaining unit. Thank you.
Very well. Thank you. Thank you for that. And my last question before I go to Senator Villaleda, the bill's sponsor, again to ICEO Williams and Dr. Amaro. How are we addressing the psychotherapy? How are we assisting the downtime or taking into consideration some of the heavy lift that our healthcare workers have been under and try to meet them halfway by being able to work through some of those issues?
I'll go first this time. So from our perspective, if I get your question correct, Senator, we do organize for our behavioral health team to visit the floors, to talk to our healthcare staff, allow them an avenue for being able to discuss their challenges, discuss the stresses that they're going through. Whenever we've had scenarios where we've lost an individual, especially if we've lost an employee, we want to make sure that there are those avenues for discussion and talk and being able to have a release and create that environment that they know that we do care about not only the work that they do, but the impact of their work on their lives, on their own emotional health. And so we, the senior leadership team makes its rounds, gives them an opportunity to vent and to talk and to discuss. We try to see that those things are met, that they discuss our needs to them. But we also do other things as incentives for them. Many of our physicians have provided meals to the floors and other things that shows the love and support to help them get through these arduous times. I hope I answered the question that you were asking.
Thank you. You did well, Dr. Amaro. That's fine. ICEO Williams.
Thank you, Senator Francis. And so we actually instituted something called Wellness Wednesdays, where we were trying to meet the whole nurse, meaning that separate and aside from the profession of nurses, certainly there are opportunities for us to bring in additional resources to meet the whole component of a person. And so we did, prior to the more aggressive season of COVID, the pandemic, that made it it's more challenging now to kind of meet in large groups. And prior to, we had an opportunity to do say for instance farming come in and do some agriculture, or have talks specific to sexuality. And really engage the whole person, so there's opportunity for discussion and kind of decompression and that sort of thing. COVID, of course, has made that a little more cumbersome because we don't necessarily meet in groups, so we have to kind of move those discussions to kind of web platforms, which doesn't really give the same interactions, but that's kind of the tools that we deal with. We also had comfort carts where we would just get treats and do our rounds on the floors, and really take a moment to really connect with the staff to hear some of their concerns more directly. And so again, COVID has kind of curtailed those opportunities, but the staff really does appreciate when we kind of take those initiatives to show them that we really do care about their service that they provide to JFL and it lets them know that we're here to listen, to their needs as they express them.
Very well. Thank you for that. And I just wanted to have this discussion because it's important that we continue to look at the whole provider. And I know in my experience under law enforcement, a lot of times you don't see the under the surface issue that plague members as a result of this. I mean, a lot of it is a lot of it becomes psychological, family issue, domestic violence, binge drinking. I don't need to tell you, I'm sure that you have the experience as head of your agency, but a lot of times there's a lot of underlying issue that manifests itself under these stressful environment when they come to work. So it's critical that we continue to monitor our workers and our rank and file to make sure that they're assisted as much as possible. And it's important that managers, head nurses, supervisors pay particular attention to the signs and symptoms that may lead to other issues or whatever. Recognize them quickly and try to get them the necessary help to resolve some of this issue. At this time, I'll go to Senator Gittens for a point of information. You could wait until after if you like, and then I'll go to Senator Violet to go ahead and make it. Go and make your point at this time. So that, go ahead.
Okay. Thank you, Mr. Chair. I was wondering if to wait until after we complete the bill. I have two quick point of inquiries, and the point of inquiries are to the Commissioner of Health and the two interim CEOs of our hospitals. And that's one. I wanted to find out from each entity how many resignations we've had at within the last 2 months, and what's the status of the COVID overflow operation that we're supposed to have I know on St. Croix. I'm not 100% sure if there was one on St. Thomas, but the one on St. Croix was supposed to be at the RTI over at the National Guard. So two questions. How many resignations we've had with nurses within the last 2 months? And what's the status of the COVID overflow plan?
I could speak about the status of the alternative care site, and then I'll have the ICOs speak about any resignation. In health, there has been no resignation. There have been 2 retirees within the past 2 months of nurses in the Department of Health. No resignation at this point in time. In reference to the alternative care site at the RTI at the VI National Guard, right now we are still working with the VA National Guard. The MOU is no longer in effect, but actually is going to be coming up real soon where it is going to be placed back into effect. Right now, we're working 2 things. We are going to be replacing all resources that were pulled away from the RTI, because the first point of concern was ensuring that JFL had the resources that they needed to supply the patients within the staff, as well as the patients within the confines of the infrastructure at JFL. So we did that. Now we're also now replacing everything that we need to replace within the alternative care sites. So both aspects, the signing of the MOU as well as the resources needed, should come together at the same time, and access to that building would once again be open. In reference to St. Thomas, I'll have Dr. Amara speak to you. We do have an extended alternative care site within the building. I think they did an excellent job as well as JFL, so I'll have them speak to that. Thank you so much.
And Senator Gittens, I will start off with where Commissioner Encarnacion left off. Department of Health, of course, in conjunction with the administration, has been very supportive in terms of ensuring that we have assets here on site to better respond to the COVID surge or the expansion of our COVID, or the increase in COVID numbers. And so Department of Health has provided us 25 HEPA filters that allow for negative air pressure spaces in our clinical care units. And of course, PPEs were centrally purchased for the territory. And so we've gotten a lot of our PPEs and support resources from that endeavor as well. And so for all intents and purposes, we've expanded our PCU unit, which I believe was 14 clinical spaces, our the cafeteria downstairs is an expansive space that we remodel to account for additional COVID patients. And of course, the Virgin Islands Cardiac Center, which we've now designated as our HIDU unit that is exclusively managing COVID-positive patients. And so for all intents and purposes, the National Guard site would come into effect if we went beyond our internal capacities and exhausted our internal space beyond being able to manage patients. What we shared from the onset is that we want to keep our patients as close to our central supplies and our very limited resources. And so that means, within the hospital, in terms of oxygen supplies and how that's piped in centrally to the organization, that's really essential to supporting our COVID patients. And of course, limited staff, it would be challenging to disperse them external to the hospital. So to the greatest extent possible, we're trying to kind of manage those limited staffing resources internal to the organization, even with the support of additional PAFFORD staffing. Specific to the resignations, I will say that we also have a concern as it relates to persons on even FMLA. We have almost like a record number of staff who are on extended leave, but they're still on our payroll. And so that has compromised our staffing significantly. At one point, it even affected our ability to maintain our operating room functions. And so I don't have a hard number in terms of the last 2 months of nurses that have resigned. We can certainly provide you with that number. But consistent with what we've represented within this conversation is we're seeing a lot of separations. We're seeing a lot of higher turnover in terms of losing critical staff. And as quickly as we replenish the staff, we're seeing that consistent cycle through the organization. And so I can certainly get a hard number for you in terms of resignations, but it's not necessarily the only area of concern. And I will share, as a result of the COVID mandate, we're also getting exemptions, and we have to work through that process as well.
Thank you. Dr. Morrow, you had something to add?
Sure. From the Schneider Regional Medical Center, as of 2020, the Schneider Regional has built up its highly infectious disease unit. Actually, we have 4 21-bed wings that are under negative pressure and capable in a real emergency standpoint of all being able to maintain any highly infectious disease outbreak. Of course, the discussion is about the pandemic and the current COVID pandemic. But right now, we have just successfully moved our medical floor up to the 5th floor, formerly occupied by the Department of Health. Much appreciation to Commissioner Encarnacion and the team for making that, for availing that space for the purposes of medical care. And our medical floor has moved up to that floor that now relinquishes and allows our previous medical floor that was made for negative pressure to be occupied by highly infectious disease and intensive care patients. That allows us to have approximately a 50-bed capacity for that purpose, and that is being occupied and being utilized for that. So in other words, right now, our limitation is rarely going to be one that is a facility limitation. It is more so one that is a staff limitation, and we're certainly supported well by the Department of Health with PAFFORD nurses and other agencies to support our own local staff during that time. As it relates to the separations, we've had 4 separations of RNs in the month of June and July. I do not have the updated information for this month to give accurately, but we've had 4 separations during that time.
Thank you. At this time, we'll go to Senator Viale, the bill sponsor, for his 5-minute round.
Thank you. Thank you, Mr. Chair. I'm listening to the discussion back and forth in reference to COVID and also in reference to the retention of nurses, but definitely part of being able to retain nurses, making sure that we have a good working environment, adequate supplies. We got to make sure protocols are in place. And then you also need to look at the other factors, home ownership. That is why we passed that first time Home Buyers Act, because they need to be provided with an opportunity to purchase a home. A lot of people leave the Virgin Islands just to have that opportunity to purchase a home. We got to look at the price of goods. There's a lot of issues relative to why the Virgin Islands are losing some of its professional staff. And a lot of it don't necessarily just have to do with pay alone, but have to do with a lot of other factors that internally we must fix. We must make sure that to the largest degree possible that we're able to create excellent working environment for our medical and healthcare staff. I came across a document yesterday, and it was a document from the Port Authority. And it was a document that is going to provide a bonus for employees at the Port Authority in the amount of $800 for being vaccinated by October 1st. And I saw that document said it was done in conjunction with the governor and the commissioner of health and somebody else. And it made me wonder back, because I know that there were some bit of creativity in trying to get our healthcare professionals paid a little bit more, a differential, COVID differential. But I began to think about just the entire hospital and not just those individuals who were working with the COVID patients, but you think about those that are providing our dietary staff, those that are making sure that they are fed, our custodians, those that go into those rooms and have to literally clean those rooms, and all the other individuals who work at the hospital, who must go in the hospital every single day. And the amazing thing about when you work at the hospital, you're going right there to meet an institution where the virus is literally contained, because there are X amount of COVID patients. And in all other walks of life in the Virgin Islands, if you know that some place have COVID, we shutting it down, we cleaning it, we ain't going back in that place for 1 or 2 days. But at the hospital, those workers go every single day, to include the emergency room. They don't have a choice. Somebody tests positive, they got to take care of them. They put on the protective gear. And I'm just encouraging the executive branch to utilize some of the COVID monies to make sure that we're able to provide a similar incentive to the healthcare workers. Similar incentive, Commissioner, because we have done a lot. $250 for second dose, $800 if you're fully vaccinated. Well, why don't we give $800 or $1,000 to the healthcare providers who have been working from last year, March, and have been working in that environment consistently? That is going to help with the retention, because part of retaining individuals is for them to feel that they're appreciated. And we just got to do something. I mean, we have an opportunity now because we have some federal funds, but the opportunity can be just to be creative in terms of we want to incentivize them to get a second shot, but the creativity also must include being able to retain our healthcare professionals. I just pulled up a story there, and it's Governor Abbott from Texas, who says that Texas needs 2,500 out-of-state nurses in order to deal with the pandemic and the effect of healthcare in Texas. So we cannot continue to think of the pandemic as a local issue. We can't even think of it as a national issue. This is a global issue. So we are in the fight of our lives. We're in a competition to make sure that we're able to retain healthcare professionals, because we only have one hospital on both islands. This bill hopefully will make licensure easier. I don't want to weaken our guidelines for licensure, but I want to make sure that we have a process in place where we'll be able to get individuals licensed. And if that is going to take some of the revenue from the Nurse Licensure Committee, then during budget markup, we need to give you what you need so that you can continue to be that regulatory entity that is going to make sure that we get adequate nursing care. And the Nurse Licensure Board have a very valid concern. There are eyes and ears to make sure that we get the quality health care that we deserve, because we also don't want somebody coming in here who have a bunch of negative on the file, or in nurses have a bunch of disciplinary action. We got to make sure that those individuals that are coming in here are those that are going to provide quality health care. But I'm encouraging both hospitals, we got to make sure that as much as possible, we have everything in place, we have all the necessary supplies, the protocols, everything, because it's all a part of nurse retention. And I'm calling on the administrative branch, because these are federal funds. We have already been told separation of powers. The executive branch, to make sure that you provide an incentive for healthcare professionals down to the custodians who have to clean those rooms on a regular basis. Most of us in here ain't going close, to include myself. I am not going to the hospital if I can avoid it. And they are not letting you in anyhow, but we all think that way to protect ourselves. But then, what is the end result? Let's change the end result. We can't incentivize Port Authority, and we're not providing an incentive to the hospital. That's kind of warped. And if you really think about it deep, something wrong with that. So let's try to change the narrative. We're going to provide incentive to whoever, but let's make sure that they get what they deserve, because any of us in here sick, or any of our loved ones sick, we're going to end up right there. And we hope that they have sufficient individuals to take care of us. Thank you, Mr. Chair.
Thank you very much, Senator Vielle, for your comments there. At this time, we'll go for closure. I think it's critical that as we continue to talk about all of these incentives that's being offered, that in fact, we want to make sure that they incentivize individuals before we have to go to that extreme case of talking about terminations and all those type of issues. I think that we need to do everything possible, again, to encourage, incentivize, and support those individuals that continue to be in the front line during this unprecedented times before we go to draconian type measures that talk about taking away people's rights and privileges, as well as their salaries and terminations and those extremes. What I'm going to do is go quickly for a 30-second closure, then we'll take a vote on this measure. I know individuals have flights to catch, so I want to be considerate of everybody's time. And we'll start off with where we began with ICEO Williams.
Thank you so much, Senator Francis. I would like to thank the members of the 31st Legislature, the Committee of Health, Hospitals, and Human Services, the Honorable Chairman, Senator Novel Francis, and the Honorable Senator Kurt Vielle, the bill sponsor, for the opportunity to present on Bill 34-0040 today. The national nurse shortage has trickled down to the territories and has encumbered our ability to recruit, retain, sustain, and grow our local healthcare system. During this global pandemic response, the nurse shortage has been even that much more profound. Our local nurses report that they are overwhelmed and spread thin in their practice, and they need the support. The Nurse License Compact allows JFL to be more agile and efficient in our recruitment and retention efforts. Interested nurses often cite the timeliness of the length of time to process their license as a reason that they lose interest in employment in our territory. Streamlining the licensing process only enhances our nursing staffing capacities that allows us to enhance quality healthcare at JFL and better serve the St. Croix community. We support Bill number 34-0040 with additional inclusion of other retention incentive, as we recognize that ease of licensing is not the only barrier that challenges our recruitment and retention of our highly skilled and highly qualified licensed professionals. Lastly, we often think of JFL and its leadership as the focal point of our hospital, and in some cases, that's absolutely true. However, the fact of the matter is, JFL has a dedicated nursing staff that continue to stand in the gap through every natural disaster and even this global pandemic. Nurses leave their children and the care of their extended families to serve our community during the most difficult times. The toll that these consecutive disasters and now this pandemic has had on our nurses is tangible. As Senator Viola expressed in his opening, our nurses have called on us to support them on all levels. The Nurse Licensing Compact would allow for additional staff to be more readily available with the support of more efficient licensing processes to support our local staff. We understand that some of our nurses may feel disenfranchised as a result of the most recent COVID vaccination mandate. I assure you that the executive team and the governing board's only intent is to protect the well-being of our critical staff and our patient community. Whereas we value individual self-determination, this global pandemic and the history has shown that vaccines absolutely save lives. We value our nurses that serve the healthcare needs of this community, and we can't deliver the care that our community deserves without them. Our team members are our superheroes, and we all stand JFL strong. We remain thankful for all our frontline essential workers, for without them, none of the work of the executive team can be realized. We thank all our team members at JFL for their continued dedication and the hard work as we stay on mission to rebuild today for a healthier tomorrow. Thank you.
Very well, thank you. Thank you very much, ICEO Williams. As a second thought, we'll go ahead and move this motion so we could get this resolved so the individuals could be able to catch their flights and then allow for testifiers to do their closing. Senator Viola, you recognize for your amendment? Motion, you recognize.
Thank you, Mr. Chair. Mr. Chair, I move that Bill number 34-0040, an act amending Title 27, Chapter 1 of the Virgin Islands Code by adding the new subchapter 5A, establishing a nurse licensure compact to create a multi-state nursing license, be granted a favorable approval in this committee and be sent to the Committee of Rules and Judiciary for further consideration. I so move.
Motion properly made by Senator Viola, seconded by Senator Gittins, Senator Blyden, and Senator Carrion. Senator Sarro as well. Roll call.
Senator Marvin A. Blyden. Senator Blyden, yea. Senator Samuel Carrion. Senator Carrion, yes. Senator Kenneth L. Gittins. Senator Kenneth L. Gittins, yea. Senator Alma Francis Heiliger. Senator Francis Heiliger, absent. Senator Janelle K. Saru. Senator Saru, yea. Senator Kurt A. Viola. Senator Viola, yea. Senator Norville E. Francis, Jr.
Yea.
Senator Francis, Jr., yea. Mr. Chairman, we have 6 yeas, 1 absent.
Say again, please, Madam Clerk.
6 yeas, 1 absent.
Very well, thank you. Madam Clerk, Bill number 34-0040, an act amending Title 27, Chapter 1 of the Virgin Islands Code by adding a new subchapter 5A, establishing the Nurse Licensure Compact to create a multi-state nursing license, have been approved by the Committee of Health, Hospital, and Human Services and will be sent to the Committee of Rules and Judiciary for further consideration. At this time, we'll go ahead with the closing comments and we'll recognize Dr. Amaro for his closing.
Good afternoon again, Honorable Senator Norville Francis, Chairman of the Committee on Health, Hospitals, and Human Services, Honorable Senator Kurt Viola, bill sponsor for Bill number 34-0040. SRMC stands again in support of the bill for Nurse Licensure Compact, as we see it as an avenue for access and improvement of our nursing shortage, as well as an ability for our nurses to access other agencies or other states for improvement in their education and their exposure to other places, hopefully being able to return that experience and expertise back to the Virgin Islands and our territories' hospitals. We do support this measure in order to extend our level of care and be able to serve the people of the Virgin Islands with a nursing level that does not see nursing shortages and does not have poor nurse-to-patient ratios. We would like to improve the work-life balance that our nurses have and be able to allow them to appreciate the profession in the way that they trained. We appreciate all the time that you provided for SRMC on the subject of the mandate of the vaccines. Again, for public health measures, we do support that mandate, and we do extend our appreciation to the Department of Health for the support of the organization with POFFED services to provide our nurses a better ability to serve in their career. Thank you very much, Senators, and to the viewing public.
Thank you very much, Dr. Omaro. And next we'll go to Commissioner Encarnacion, Department of Health.
Senator Francis, thank you, and the members of the Committee on Health, Hospital, and Human Services for allowing us to be part of a much-needed discussion. I commend Senator Vialé for bringing a bill to implement a nursing impact compact in the VI back to the committee that has now gained the support of VISNA, the VI State Nursing Association, and the VI Board of Nurse Licensure. The bill will prove beneficial in our effort to recruit nurses in the territory and even give our nurses the ability to go abroad and in time return to care for their own. It poses a challenge to each of us that hire nurses, and that is to up our game when it comes to retention efforts. Again, the additional amendment to the bill that speaks to presentation of the documents that list hires throughout the territory within 60 days of hire to the VI Board of Nursing Licensure allows for regulatory oversight and the ability to track information that's so needed. The governor has presented many incentives to encourage vaccines. He has also scheduled a meeting with both ICUs to further discuss how we can provide further incentives to our clinical staff. We acknowledge the work the clinical staff has done and commitment that they have shown to their patients and fellow staff members. We also want to thank them for what they do, and in turn thank the ICOs for all the work that they and their administrative staff have done as well. As we come to the end of the day at the legislature, I would like to thank the senators for your support as we continue the work in the fight against the COVID-19 pandemic and the severe illnesses and deaths that follows the disease. Of course, Senator Sorrell, thank you for your historical perspective as it relates to our current state. And yes, please wear your mask to cover both your mouth and your nose. Wash your hands when you can, and hand sanitizers when you cannot. And of course, practice physical distancing. Most importantly, please take the vaccine. Thank you so much, Senator.
Thank you very much, Commissioner Encarnacion. And next we'll go to Chairperson Penn. You're recognized for your closing.
Thank you, Senator Francis, Jr., Committee of Health, Hospital, and Human Services, as well as Senator Vialé's bill sponsor, 34-0040. Thank you for allowing us this opportunity to work forward into continuing our efforts to protect the health and the public and integrity of the board as executed by the laws, rules, and regulatory governing VIBNL. With the implementation of the compact, we welcome all support of all entities involved to have a smooth implementation process. I want to thank all the nurses across the territory for their hard work and dedication. Thank you.
Thank you very much, Chairperson Penn, and I appreciate the work that you continue to do over at the Virgin Islands Board and Nurse Licensure, along with the entire board and the executive director. At this time, we'll recognize Attorney Fosh for her closing comments.
Hi, and I just wanted to say thank you for allowing me to testify, and that I will continue to be available for any additional questions that may arise as you kind of navigate through this process. But once again, NCSBN is very supportive of the NLC and think that it would do very good things for the COVID-19 pandemic and nursing shortages in the Virgin Islands. So thank you.
Thank you very much, Attorney Fosh. This has been a very productive day. Today we have heard from organizations who work behind the scenes of our hospitals, government agencies, who all play important roles in our health and dental care systems and have provided insight on these bills. My thanks to them. It takes
teamwork to create strong legislation. I appreciate everyone's effort towards bringing these measures forward. I can't close without again extending my appreciation to all of our healthcare providers, those individuals that continue to put themselves on the front line and make the ultimate sacrifice on our behalf every single day. We certainly appreciate you. We thank you. We pray for you and continue to hold you up in our prayers. I want to really thank my colleagues for their participation today. I want to thank Central staff again for assisting in this meeting, as well as my staff for a very productive day. The Committee of Health, Hospital, and Human Services stands adjourned. God bless.